Okay, good morning, everyone. I am Kenneth Connell, the president of the Healthy Caribbean Coalition. If I look exhausted, it's because I've been taking in some of the crop over activities here in Bridgetown, Barbados. And if you are not here, you need to be taking in some of the action. Esteemed partners, stakeholders, people living with NCDs, and Caribbean global citizens, welcome to this CARICOM Regional Stakeholder Meeting hosted by the Healthy Caribbean Coalition in support of the fourth UN High-Level Meeting on Non-communicable Diseases, including mental health. As I created scripted remarks to address you briefly this morning, I couldn't help but reflect on the question that has kidnapped my thoughts over the last few days in preparation for this meeting. Why are we here? And I guess more precisely, why are we here again? Today, almost 2 decades after the Port of Spain Declaration and 2 months before the UN high-level meeting in New York, we are here again having this seminal discussion. As we move towards New York, however, the Healthy Caribbean Coalition has posed 5 key asks for CARICOM heads of government: to commit to the continued leadership on NCD prevention and control, support the 12 CSO-led advocacy priorities, support one or more people living with NCDs and CSO representatives to be part of their delegation, and supporting the hosting of a high-level meeting side event. Today, as we interrogate this discussion, I hope to provoke your thoughts around some of my thoughts around the NCD agenda and where we are and possibly where we need to be. Perhaps the traditional methods and the traditional actors and the traditional means of engaging them need to be rescripted. Let me use a few examples. In my own neck of the woods in academia, the academic voice has been relatively silent in the Caribbean region on NCDs. Now, before my colleagues jump at me and say, well, we have had several seminal papers that have led to policy changes. I appreciate the research and all the pedagogical changes to our curricula, enhancing the NCD agenda and fight. However, how often have we heard academia speaking directly to the public, the man and the woman on the street, making it known their thoughts and ambitions for the NCD agenda? I am not only speaking to the faculties of medical sciences or schools of medicine throughout the region. What about the faculty of culture, creative, and performing arts? What is the role of culture in this season of carnivals and cropovers in influencing behavior? What about the faculties of law? Is health really a human right? I know it is, and you know it is, but do our citizens really know it is? And can they therefore make informed decisions and hold their leaders accountable? Have you increased the volume on your microphone sufficiently? And have you been out there in the public? What about the media? Many media practitioners are already on this call. I'm sure you're taking notes and will hopefully produce pieces in the various publications on traditional and social media. But my question to you is that the only role for media in this fight going forward? Or does media have a more strategic role in the NCD plan of action? Media, for instance, is responsible for sanitizing the misinformation and disinformation that our impressionable minds receive. What is your responsibility there? These are things that I hope will occupy our thoughts. This is an organization or a meeting with civil society organizations, and I do not want to kind of absorb us from the responsibility that perhaps we are doing everything right. We aren't. Let me use an example in my own country, where quite recently a civil society organization received a donation, a minimal donation from the unhealthy food industry, and it was all over social media. Are we really all then one united choir singing on the same hymn sheet? Or even within our own bodies, do we need to regroup and rethink the impact of conflicts of interest within our own space? I want you to enjoy this morning's webinar, but I want you to think of these provocative comments that I've made and hopefully see that it cannot be business as usual in a traditional manner. I thank the panelists and all other presenters for being in the HCC space, but more importantly, I thank you, our listeners, for engaging and for provoking us with your thoughts as well. And so with those brief remarks, I'm going to hand the floor or the podium virtually over to Dr. Anselm Hennis, the Director of NCDs and Mental Health at Pan American Health Organization, who will deliver pre-recorded remarks. Enjoy the webinar.
Good morning, good afternoon, and good evening to all of you joining us from across the region and beyond. I'm honored to speak at this important Healthy Caribbean Coalition joint webinar in the lead up to the 4th United Nations high-level meeting on non-communicable diseases and mental health. Across the Americas, over 240 million people live with at least one non-communicable disease or NCD. And these include cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases. In 2021 alone, 6 million people in the Americas lost their lives to NCDs, accounting for 65% of all deaths in the region. But perhaps even more alarming is that 2.3 million of these deaths occurred prematurely in people aged under 70 years. These are preventable losses, cutting lives short and leaving deep and lasting impacts on families, communities, and even national development. We must also confront the mounting crisis of mental health. Each year, over 100,000 people in the Americas die by suicide. In stark contrast to global trends, suicide rates in the Americas have increased by more than 17% since 2000. This marks suicide as a growing public health emergency, and it demands urgent and coordinated action. And in fact, 2 countries in the Caribbean region are listed among the 10 countries in the world with the highest suicide rates. The burden of NCDs and mental health conditions stretches far beyond individuals. These conditions place enormous pressure on our healthcare systems. They result in lost productivity and generate significant economic costs, which may increase to billions of dollars in lost GDP annually in the region. And yet, this is not a new conversation. The global journey to address NCDs began right here in the Caribbean sub-region. In 2007, heads of state and leaders of government in the Caribbean came together in Trinidad and Tobago, where they adopted the Port of Spain Declaration, calling attention to the devastating impact of NCDs in populations, health systems, economies, and indeed national development. That call to action moved the dialogue to the global stage and laid the groundwork for 3 United Nations high-level meetings, which took place in 2011, 2014, and 2018. As we look ahead to the 4th high-level meeting, it is vital that the Caribbean once again steps forward as a strong, united voice in this global effort to prevent and control NCDs and mental health conditions. We already know what works. Governments must adopt a comprehensive whole-of-government approach to NCDs and mental health conditions. This means that ministries of health cannot work alone. We must bring together sectors which include education, agriculture, transport, and finance, among others, to create environments that support and promote healthy choices. It is also essential to strengthen primary health care so that prevention, early diagnosis, and treatment of NCDs are fully integrated into local clinics and the offices of family doctors, where people are most likely to seek cure. Fiscal policies must be used wisely. These include taxes on tobacco, alcohol, and sugary beverages, which have been shown to reduce harmful consumption while also generating much-needed revenue for public health initiatives. At the same time, we need to improve our surveillance systems. Good data are the foundation for good policy. and more robust monitoring allows to track trends, measure progress, and tailor interventions for maximum impact. Most importantly, we must also address the deep inequalities that shape health outcomes across our region. Vulnerable populations suffer the most from NCDs mental health conditions, and targeted actions are needed to close these gaps and ensure that no one is left behind. From a sub-regional perspective, the Caribbean plays a particularly important role as it represents 40% of all small island developing states, or the SIDS. These countries face a unique set of vulnerabilities, including geographical remoteness, small and undiversified economies, a heavy reliance on international trade, and limited health system capacity, all of which are exacerbated by the growing effects of climate change. The burden of obesity and the risk of food insecurity are particularly high in these settings, and small and developing states are particularly vulnerable to the commercial determinants of health, the marketing and availability of unhealthy products that underpin poor health outcomes. For over 25 years, the Pan American Health Organization has been at the forefront of technical cooperation in NCDs and mental health in the Americas. We support countries in developing national policies and multi-sectoral action plans, implementing cost-effective interventions at the primary care level, and this includes the HEARTS Initiative for Hypertension Control. Our work also encompasses strengthening surveillance and regulatory frameworks. PAHO is proud to be actively involved in the preparatory process of the fourth high-level meeting on NCDs and mental health conditions, in close coordination with WHO and our partners across the region. We are particularly pleased to participate in today's webinar, and we look forward to continuing this journey with you towards a strong, relevant, comprehensive, and equity-based political declaration on NCDs and mental health. Together, we have the tools, the knowledge, and the experience to achieve lasting progress. Let us act with the urgency and determination this moment demands and build a healthier, more resilient future for us all. Thank you so much.
Thank you very much, Dr. Hennis, and we will move right on to the next set of remarks. HCC is very fortunate to partner with many stakeholders, including the CARICOM Secretariat, as well as CARFA. I'm now going to ask Ms. Helen Royer from the CARICOM Secretariat to deliver remarks on behalf of the Secretariat.
Thank you very much, and I would like to recognize and acknowledge the presence of our moderator, Dr. Kenneth Connell, HCC President also, Ms. Maisha Houghton, CEO HCC, Dr. St. John, past our colleagues, and presently the chair of the vice chair of the Technical Advisory Committee of the Pandemic Fund, Dr. Horace Cox, Acting Director, Disease Surveillance at CARFA, representatives from PAHO, other distinguished members of the panel, and all invited representatives of government and civil society and representatives of the member states. Good morning, and permit me to bring greetings from the Secretary General for the CARICOM Secretariat, Dr. Carla Barnett, and the Assistant Secretary General of the Human and Social Development Directorate, Ms. Alison Drayton, who is unable to be here with us today due to other exigencies. Actually, she's attending another meeting. The Secretariat is pleased to be part of this stakeholder meeting that will facilitate discourse between representatives of ministries of health, regional health institutions, and civil society organizations on the upcoming 4th UN high-level meeting on NCDs and mental health. Addressing the epidemic of NCDs remains a high priority for all CARICOM member states and associate members. Participation in this high-level meeting serves as an opportunity for CARICOM to renew its political commitment to working towards reducing the premature mortality and morbidity from NCDs. As you may be now aware, the CARICOM Secretariat, in collaboration with partners CARFA, HCC, and PAHO, will host a high-level side event on September 25th, 2025, in the margins of the UN high-level meeting. In this event, member states will have the opportunity to celebrate their successes and reflect on how we can collectively accelerate the progress of NCD initiatives where this might be possible to achieve the Sustainable Development Goals. As key stakeholders, your contribution will help shape this dialogue, and your actions will contribute to the regional response to NCDs, which requires a whole of society approach to realize our goals. Therefore, we look forward to your input. The CARICOM Secretariat wishes you a successful webinar and looks forward to continued collaboration with all partners as we forge a path towards a healthier future for the community. I thank you.
Thank you so much, Ms. Ryer, for your kind greetings and words of support. I'm now going to call on Dr. Horace Cox, the Director of Surveillance of Disease Prevention and Control at CARFA, to deliver brief welcome remarks as well.
Thank you very much to the chair and to the organizers for facilitating CARFA's participation in this very important event. Just to know that the executive management team is very thankful for the opportunity. And from CARFA's perspective, we'd like to share that epidemiological shifts occurring indicate that we must refine health system outputs to ensure that we have efficient, effective, and responsive systems that will guarantee our achievement of better health outcomes tied to non-communicable diseases. As such, CARFA recognizes its important role in keeping this on the policy agenda as part of driving meaningful change. So as we come together to reflect on our journey since the 2007 Port of Spain Declaration, it's important that we take pride in the Caribbean's leadership in bringing non-communicable diseases to the world's attention. CARFA has helped to address member states, has helped member states, better said, to address NCDs through research, policy development, training, and advocacy. With efforts such as Caribbean Moves and also in leading the conversation around the 6-point policy package, CARFA brings together science, leadership, and action. But despite our progress, significant challenges do remain. NCDs account for nearly 80% of deaths in our region, and the situation is worsening due to social determinants of health not being adequately addressed. We must reaffirm our commitment to bold, unified, and responsible action. It is essential to prioritize prevention, integrate mental health into primary health care, and involve those affected by NCDs into the whole policy making and design process. I wish everyone on behalf of the Caribbean Public Health Agency a very productive and inspiring meeting, and I hope that our important work together will continue for better health outcomes. Thank you so much.
Thank you very much, Horace, for those remarks. And I know that this was done. There are lots of things happening in the CARFA arena. So thank you very much for joining us this morning. I know you've made a significant effort. Let's move on in the program to the people behind NCDs, lived experiences, and people living with NCDs. And I'm now going to invite Miss Diana Gittins, a member of the HCC People Living with NCDs High-Level Advisory Group, lived experience advocate, to deliver brief remarks.
Kenneth, may I interrupt you for a moment, please? Apologies for this, but the minister has joined us, and I believe his calendar is time sensitive. He was able to just get on, Minister Prince.
Excellent. And so I will say just in the nick of time. Thank you, Maisha. Minister Prince, I am going to introduce you now then. And as our featured speaker, thank you very much for agreeing. St. Vincent and the Grenadines, Minister of Health and Ministry of Health, and your significant commitment to NCDs and the HLM4, of course, as co-facilitator for HLM4 negotiation process. So thank you very much for being here. And I'm now going to invite you not just to travel for crop over, which you promised you would, but also to deliver remarks as well.
Yeah, I look up over next year. Thank you very much, Mr. Chairman, Mr. President, esteemed colleagues and participants of this stakeholder meeting. Good morning. From the outset, let me apologize, first of all, for not being able to spend the entire duration of this webinar with you. Of course, today's Cabinet Day, and I have to repair to the Cabinet Room in a few moments. There has never been a more important moment to review CARICOM's and the world's progress with the fight against NCDs. We must see the crisis of non-communicable diseases not just as a health issue for our countries, but a real threat to our social and economic development, a threat to the very survival of our states and of our people. This crisis of non-communicable diseases and its impact is characterized by a heavy burden of disease and limited resources. Let us, however, not be paralyzed by this. Bold and decisive actions are necessary. We have just seen the back of the worst pandemic in history, certainly in the history of the Caribbean. While our tourism and service-rooted economies in the Caribbean had a miraculous rebound to pre-pandemic levels, COVID-19 took a human and mental health toll on our vulnerable people in all sectors, including medical and public health professionals. The psychological and economic cost of this event is still being assessed. From a Ministry of Health perspective, I have seen the health gains of the 2010s, especially NCDs programming, almost completely roll away in 3 short pandemic years. We are proud that our permanent representative to the United Nations, Her Excellency Ambassador Inga King, is serving as one of the co-facilitators of the 4th UN High-Level Meeting on NCDs. St. Vincent and the Grenadines takes a purposeful place in the history of leadership of the Caribbean in the fight against NCDs. We have an interministerial committee which deals with NCDs, and this committee is co-chaired by the Prime Minister and also the Minister of Health. We also are setting up a health facility which will deal exclusively with the prevention and management of NCDs here in St. Vincent and the Grenadines. In 2025, the Caribbean needs a revolutionary policy, imperative that we start the unifying action that will drive momentum towards a health-sustaining CARICOM region. We, in our individual states, must begin to put these issues of health at the forefront of our deliberations. Our cabinet, our parliaments, civil society, churches, and schools must be seized of the importance of these diseases. I turn for inspiration to the 2007 Port of Spain Declaration. 18 years later, it is still seized with a temporally appropriate vision with the people of the Caribbean as its focus. Caribbean Moves has been initiated to address increasing region-wide physical activity, wellness, and healthy lifestyle changes. This provides a strong platform that brings together prevention strategies like promoting physical activity, healthy eating, and is a great way to get communities engaged in healthier lifestyles. And somebody mentioned earlier that we must bring everybody together to deal with this issue. It remains an unfulfilled imperative that the CARICOM region lends its support for mandating the labeling of foods or such measures as are necessary to indicate their nutritional content through the establishment of the appropriate regional capability. The CARICOM Health Compact, provided by the Caribbean Cooperation in Health, has been a remarkably successful decades-long platform for regional achievements in public health, as the health of the region is, of course, the wealth of the region. Overseas development assistance for health has dwindled considerably with changing geopolitical priorities, and this is a problem for us now in these small states. Homegrown Caribbean ingenuity on a unified CARICOM platform is needed more than ever to strengthen prevention programs and address the increasing severity of the NCD's impact on the lives of Caribbean men and women, boys and girls in their most productive and formative years. We must work together hand in hand with other ministries working in collaboration across all sectors, including civil society, while centering the voices of people living with and most at risk of NCDs, including young people, our future. As mentioned earlier, bold and decisive actions must be taken. Today, your challenge on this webinar is to develop the discussions aimed towards solutions to the barriers to implementation of these actions, so CARICOM can regain the life-saving momentum we so desperately need. I thank the HCC for creating the space and for continuing these frank and productive discussions. As we prepare for the 4th UN High-Level Meeting in September of 2025, it is imperative that we have strong CARICOM participation with visions for a positive outcome. It is time for CARICOM to lead again. I thank you very much.
Thank you very much, Minister Prince. And I want to say publicly that your words here are very well received, especially at this time I recently said to a journalist at the Hyatt Hotel in Port of Spain that we must not be totally disappointed at the absence of the NCDs in the official CARICOM communique, because there are still very strong political leaders out there like yourself who are willing to push the NCD agenda and to make the time and commitment to walk the walk with us. So thank you very much for being here and for representing leadership in NCDs.
Thanks for having me.
Thank you. And let's move right on to the next presenter, who I'm sure already knows that she's up next. It's Diana Gittins. People behind NCDs, the lived experience of people living with NCDs. Diana, I'm always very anxious to hear your presentations. Go right ahead.
Thank you so much. Two introductions, exciting. So good morning, everyone, and I'm honored to be here today. I'm grateful to the Healthy Caribbean Coalition for making spaces for voices like mine, voices of people living with and surviving non-communicable diseases. At age 28, I was diagnosed with cervical cancer, stage 3B cervical cancer, and that was 2011. And even now, over a decade later, that moment still shapes how I move through life and how I show up in the advocacy work that I do. As most of you would have known, at 29, I wasn't thinking about cancer. I had no idea what a pap smear could detect or how crucial early screening was. But
Diana,
suddenly,
I'm going to interrupt you because someone is asking, is this the real Diana or the AI version? So can you please turn your camera on?
I'm trying. I've been trying to turn it on, but it's telling me that
Oh,
that
you're
my
having technical
something's wrong with my
difficulties.
settings. Yes. So
Okay,
I've been
sure. Go
clicking
ahead.
next start video.
Go ahead. I'll take your word for it. Go ahead.
I will try. Thank you so much. Yeah. So at that age when I was diagnosed, I was saying that I had no idea as to, how crucial early screening was. But suddenly I was navigating chemo, internal radiation, facing infertility, and of course, a significant amount of fear because of the unknown. What I experienced was deeply personal, but it was incredibly systemic because I had to fight not just the disease, but a system that wasn't designed for our early access or for young women like me who didn't fit the typical patient profile. And I think that's where the urgency lies. Too many people are slipping through the cracks, not because they're careless, but because our structures haven't fully adapted to protect or empower them. And moving into the next phase is like saying, we talk a lot about policy and planning, but what we still don't talk enough about is people. And that's why I want to echo the call for urgent action, especially around the first area of the multi-stakeholder engagement mechanism. We need to institutionalize the engagement of people living with NCDs, not just to invite us to speak occasionally. We need permanent spaces where our voices inform decisions. And I'm going to repeat that. We should not just be invited to speak occasionally. We need permanent spaces where our voices inform decisions. The Port of Spain Declaration gives us a powerful foundation, but this is still a gap that still needs closing. In addition to that, we need great investment in civil society, especially those doing frontline work in underserved communities. In my own journey, I have worked extensively with the Dominica Cancer Society, and in Guyana, I've supported Pinktober initiatives across the country. That work matters, but without funding, support, and clear partnerships, it's hard to scale, sustain, or deepen. Finally, there's a clear need to empower communities, not just educate them. Information is good, but what people need are options, access, and support. It just can't always be awareness. It has to be action and equity. So today, I want you to take into consideration that behind every policy brief is a person, like me, a mother, a daughter, a friend, a youth in a rural community, and a survivor trying to make sense of life after treatment. As we prepare for the 4th UN high-level meeting, let's not just measure progress by numbers, but by how deeply we're engaging people on the ground, people like me with lived experience. Lived experience shouldn't just be a box that we tick. It's a tool for designing better systems. So I'd like to thank the HCC for always giving me the opportunity to share my story. And I'm not here for you to offer sympathy, but I want to be here as a reminder of why urgent, inclusive, and community-driven action matters. Because I survive, but I want you to remember that many won't if we don't act now. And yes, this is what I look like. Thank you so much for sharing.
Thanks very much, Diana. Thank you. And we appreciate the technical difficulties. I'm just monitoring some of the conversations in the chat. And no, the first presenters did not have slides. So you were listening to the oral presentations and remarks. But thank you very much for highlighting that. But for those of you who are more visually stimulated, we do move on to a presentation with an update on the preparatory process for the fourth high-level meeting by Linda Markova. Linda has been introduced earlier in the pre-meeting as a CARICOM citizen, an honorary CARICOM citizen. Linda, I'm going to invite you to deliver your remarks on behalf of the NCD Alliance. Thank you.
Thank you so much, Kenneth, and good morning to all of you here, distinguished guests and panelists. I'm going to just try and put my slide on, so just 1 second, please. Can you see the slides?
We're seeing your slides perfectly. Thank you. Go right ahead.
Perfect. So as I said, thank you very much for having me and for welcoming me as a very honorary citizen of the CARICOM here on behalf of NCD Alliance. NCD Alliance is a global network of over 400 members, civil society organizations in 80 countries, over 80 countries. So I want to really thank the Healthy Caribbean Coalition for their leadership and this region's continued leadership and commitment in this space, which continues to really inspire our global movement at large. So as Kenneth noted in his opening remarks, we're here to discuss the upcoming high-level meeting. And this is now the fourth high-level meeting. So while we've had many discussions and commitments over the years, I think what we need moving forward, as others have noted as well, is not only renewed political will, but also concrete, measurable action. And so how do we currently measure and stand against that is something that I'll try to allude on in the next few minutes of my presentation and comment on how we're seeing the negotiation process of the political declaration coming up in particular. So, okay, great. Sorry, I was just getting a pop-up window on my slide. So those of you who have been following the high-level meeting process, the high-level meeting obviously happens on the 25th of September, 2025 in New York, but that's just a culmination of about a year and a half long journey of different preparatory meetings, consultations, negotiations, different things that do come in that outcome of a political declaration, which is a text that all of the different member states of United Nations have to agree on, and that gets formally adopted in that meeting in September. So where we are now is that we're very much at the end stretch of the negotiations of that political declaration text. We're at the end of July, and as we're speaking today and tomorrow, there are final negotiations of that final version of the text being discussed in New York. And after that, we'll have what is called so-called silent period, which means that the text is more or less considered final and gets formally adopted in that meeting in September. But unless any member state has any major red line objection on the text, it is considered closed. So when we zoom into that political declaration timeline so far, this has been a process ongoing from about mid-May, and we've seen a number of different iterations of the text over the past couple of months. And as I said, the version that we currently have on the desk circulated is called Rev 2, Revised Text 2, and it's being currently discussed and negotiated by the member states as we speak. And we understand that the next thing happening is that probably at some point next week, the co-facilitators, who are the two member states who are leading the drafting of the text, will be circulating the final draft version for silence. And unless the silence is broken, text will get adopted. What NCDA has done, and obviously NCD Alliance as a global network uniting very different organizations from different countries and different regions across the world, we've been following this process very closely and acting as sort of an umbrella unifier, trying to push our messages of the united civil society NCD movement to our members. And so with that, we've been with each version of the text producing a side-by-side commentary, looking at what's in the text and sharing it with the member states. We've also been providing and doing more of a key analyzed messages that are disseminated publicly and available on our website. We also have been doing comparisons with our key asks as a global movement, which is the call to lead, and I'll speak about that in a second, but also trying to engage our members. We've been doing things like producing different template letters that regions and countries and different civil society organizations can adapt to their own use and to their own context and use them for their government reach out. You can find all of our resources online as you wish to use them. So with the revised text 2, with the Ref 2, and with the call to lead, so just to preface this a little bit, again, I'm not sure how much have all of you been following the work of NCD Alliance, but we as a global community, we came together with our asks for the high-level meeting, all of this right back, year and a half ago, and we have 5 key asks that we then made more succinct into 3 main asks, obviously with community engagement and integration being kind of cross-cutting these 3. And so we have the call to lead on NCDs, which is our key kind of open letter advocacy tool that we kind of signed as a global community. We now have, I think, about 2.5 signatures representing about 2.5 million people on this. So if you haven't signed on to this call to lead yet, we definitely urge you to do so. And here we focus on 3 key areas: on mobilizing investment, accelerating implementation, and delivering accountability. Again, with things like community engagement, social participation, and meaningful involvement of people living and NCDs being important throughout all 3 as such. So with the tone of negotiations, because that's something that I was asked to reflect on a little bit as well, like where we are and how is the Ref 2 looking and where do we go from here. Just to say that always going into this process, we kind of understood or knew that it's going to be a tough environment for negotiations. We're operating in an increasingly political environment. Within the UN, there's less agreement between the member states on the, for example, SDGs, and multilateralism as such seem to be at a critical inflection point. And we have to acknowledge that obviously the world as such is not in a great shape, with multiple different political crises happening at the same time. With this, it's been also a little bit difficult, we found, to get a really sustained engagement of different member states. And that's because, for example, when the zero draft dropped, it was in the middle of the World Health Assembly, which is one of the biggest, health meetings in a year. So it's been difficult to get member state focus on this process, while, for example, in June, some member states have been more focused on a parallel process that's called Financing for Development, which is also, it's a different thing, but it also relates to some economic, social development agendas, and therefore it's been a bit diluted, the attention and the capacity that member states had fully to engage. But also, while all of this is happening, industry, health harming industry is being very active, speaking to different people and making their case with member states as well. And we definitely something that we've seen coming up specifically now with the latest version of the text, when some of the language that's been relatively good or solid in the previous versions of that text has been now weakened and watered down. So with the Ref 2 text, that's something that we've been really concerned about, is that the critical areas, and I'll elaborate on this in just a second, have been, as I said, weakened or removed altogether. And that pertains to things like fiscal measures, targets, prevention policies, and promoting healthy environments. But also, for example, the one reference on commercial determinants that's been there kind of has now been removed. And when it comes to social participation and community engagement, there's only one reference to civil society in that entire text, which is not great either. So our detailed analysis, you'll be able to find that online, and I will not have time here to really go into all of this, but just to kind of give commentary on some of the key areas that we've seen as they relate to the call to lead. Here, basically the baseline urgent call is really to support the targets, reinstate strong language on things like the fiscal measures, and focus on that kind of proven cost-effective NCD prevention policies and safeguard policymaking from conflict of interest. The other areas that have also been touched upon in our commentary, such as air pollution action, some of the things that pertain to access to medicines and financing and fiscal protection, you can refer to in our full analysis. So now going into a little bit more detail into different areas. When it comes to the mobilized investment bucket, the kind of concern here is that the REF2 text as it currently looks now really weakens some of the earlier commitments on fiscal measures for NCD prevention. So, for example, even with the language that's being used from subtitling one section, mobilize and increase, to mobilize and strengthen, it kind of shifts the focus away a little bit from the urgent need to scale up investment to a little bit more kind of passive commitment. Same language around health taxes on tobacco, alcohol, and sugar drinks has been diluted, further undermining commitments to proven, impactful, and widely supported health tax policies that could really significantly benefit public health and national health policies. And other references to measurable financial targets and clear investment are basically missing. So that's basically where we are in that area. And so our kind of asks for the member states have been precisely mirroring this to kind of reinstate that stronger language on health taxes and effective as effective and equitable NCD prevention tools, include specific measurable targets, and promote kind of WHO best buys and other kind of packages that are then very directly link it in the text, but also ensure sustainable financing mechanisms through national budget and global cooperation. So when it comes to the accelerate implementation bucket, here is where we, I think, see some signs of industry influence by some of the language that's coming through. And that's, for example, with the weaker stance on implementing proven effective policies, such as alcohol measures, tobacco policies falling short of full alignment with FCTC, references to processed foods and sugar-sweetened beverages being removed, while also backsliding on the including targets. And I'll speak about the targets in a moment. But also we saw that section on healthy promoting environments significantly weakened as well, with references to best buys, prevention policies removed or diluted, reference to commercial determinants removed, and also references to climate change and climate resilient health systems removed as well. With accountability, here's where the targets come in. So in the previous versions of the text, we've had 5 tracer targets that have been incorporated. And while we've understood that there have been a strong pushback against them, we welcome, therefore, that they're still in there, but they have been significantly weakened. And when they've been calling for 80% of countries to implement critical measures, now it's only 60. So it's, again, our call is to basically have the member states to retain and restate these as well. Final point I want to make is on the community engagement. As I said, so society is referenced only once in the text, and so we really do, and I think this is what call for us as civil society to really do urge member states to recognize, support, and enhance the crucial role that we as civil society have in the NCD response across the board. And that's also actually something that has been recognized in the previous political declaration, so it would be really a shame to see this backslide. And while, for example, we do welcome the retention of language recognizing the important role of people living with NCDs and their expertise, this language could be very much strengthened, as well as, for example, in other sections, there is language that acknowledges the unique experiences and expertise of people living with NCDs and their carers, but also references to, for example, equity and rights-based language has been basically removed as well. So this is just not great overall. So what we've done with NCDA as a response, as with each other iteration of the text, we've produced our analyses and we've distributed them as widely as we could, because we're approaching those final negotiations this week. What we've done last week and throughout this week, we've tried to push advocacy alerts through network. We've revised our template letters, we've done a media release and tried to do a bit of a noise around that. This is where the text is, and this is what it implies for us as an NCD community moving forward. But we've also tried to do some targeted outreach and follow up with governments, with advocates, with alliances in key geographies, and make sure that we get the engagement that we need to get this on the radar. And therefore, I would ask all of you here on the call as well to really, as Kenneth was saying, it's time to now for us to come together as a movement from every region, every country, every quarter to really let people and our decision makers know that we're the pulse that that basically reminds people of what's at stake. So beyond the political declaration, as I said, we do need to keep the governments engaged. We need to ask at the highest political level representation with strong interventions at the UN floor, at the high level meeting, make noise in country during the week for action on NCDs, because not everybody will be in New York during that week. So we do need to make sure that we use our resources where we can, and also think about follow up after the high level meeting, because the high level meeting is not a cliff ledge. And if if the declaration is not good, the advocacy continues. And if the declaration would end up being great, the advocacy would have to continue either way, because we would need to make sure that it gets translated into our national and regional action. So the work continues. I know it's been a bit frustrating process to navigate for everybody, but I hope we can still make most of it. Please keep us updated on your actions here in the email. And just to kind of give you some recap of the dates, and to say that we as Global NCD Alliance, we've been hosting our monthly advocacy webinars to give updates through the whole network. Everybody is invited. You can receive invitation through the newsletter sign up on the link, and I'm sure we'll circulate the slides. And the next one is next Wednesday. So hopefully we'll have some intelligence to share after the last round of negotiations. So that's it for me for now. Thank you very much for this space, and yeah, good luck with all your advocacy moving forward.
Thank you very much, Linda. Thank you very much for that very fulsome presentation. And I know that members of the audience who are not directly as involved in the NCD space will find a lot of this information a lot to consume just on a webinar. But the good news is you don't have to. You can either join the NCD Alliance platform and see what's happening on the platform, the update as we move towards HLM4, or you can follow the HCC on our social media sites, because we are always tagging you guys and your content. And of course, drop us your email in the chat so that you can join our newsletter or roundup, which is produced weekly. So you can hear all that's happening and really take your time to consume the information and to lend your public voice to the movement. So I'm going to move on now with a presentation on behalf of the Pan American Health Organization. We heard from Dr. Hennis earlier, but Ms. Dolores Undersurhu, the Technical Officer of NCD Surveillance and Monitoring, PAHO WHO. Dolores, yeah, your camera is on. Thanks for joining us. I know you wish you were here in person, but go right ahead with your presentation. Thank you.
Thank you very much. So I will share my slides. Good morning to everyone. It is a pleasure to be joining you today. Just give me a second. And hopefully you can see my slides. If you can confirm.
Yes, we can.
Perfect. Thank you so much.
Thank you.
Okay, so good morning. As I said, it is a pleasure to be joining you today. I would like to share with you an overview of PAHO's contribution to the preparatory process related to the UN high-level meeting, and also share the latest data that we have to help us understand where we are, what opportunities we have to improve in the region and in the sub-region of the Caribbean. And at this point, we'll know what was the road that led us where we are. Previous UN high-level meetings where several commitments were made, several monitoring frameworks were adopted to help us measure progress. So that's what I want to share with you today. And of course, as we know, the Caribbean having a leading role in 2007, with the Port of Spain Declaration. So hopefully the sub-region will have a leading role this time as well. So I won't spend too much time on this slide, but we know what the meeting is about. I will focus on the progress that has been made since the last meeting, and basically the importance of reinforcing the commitments that were made by countries at the previous three high-level meetings on NCDs before this one. So how, from PAHO, we have been supporting member states in preparation for the UN high-level meeting. Well, we've had several activities in the past few years. We've been having virtual meetings with national NCD program managers to review the progress towards the targets. We have, of course, as you know, supported the SIDS Ministerial Conference that led to the Bridgetown Declaration on NCDs and mental health. We also produced briefings on the UN high-level meeting on NCDs, mental health for leaders, for advocates, for general public, with key messages that you can access online. In 2025, we had a regional meeting on NCD prevention and control in Brazil, where several focal points. Many of the Caribbean region joined us to discuss progress, to identify key actions, opportunities, and priorities. And some of them are in this webinar as well. And recently, we had a call for best practices in NCDs in order to create a collection of successful NCD interventions based on the best practices. And those are going to be disseminated on our side event at the UN high-level meeting. So moving to the next slide. Following the Brazil regional meeting that we had in March, the Caribbean focal points met and discussed, and there were a few key priorities that were identified. Of course, urging heads of state to participate in the UN high-level meeting, to contribute to the development of the outcome document, to make sure that the priorities of the Caribbean sub-region are taken into consideration, and also the technical priorities that were identified that have to do with the improvement of NCD diagnosis, treatment, and control through the strengthening of primary healthcare, integrating NCDs into primary healthcare, the expansion of access to essential medicines and technologies, and the PAHO Strategic Fund might be an appropriate mechanism for that. The integration of NCDs into routine public health surveillance systems to produce facility-level data, patient-level data, and also the increase of health taxes for unhealthy commodities such as sugary beverages, tobacco, and alcohol. So what exactly we are assessing, looking forward to the UN high-level meeting, and you're probably familiar with the NCD Global Monitoring Framework, which was adopted in 2013, and that tracks the implementation of the Action Plan for the Prevention and Control of NCDs with 9 voluntary targets and 25 associated indicators. In the center of it all is a reduction of NCD premature mortality, and then we have targets related with the reduction of risk factors and also the system's response. So based on the recent data, we do have mortality data for 2021. NCDs regionally represent 6 million or 65% of the total deaths. And of course, we see the impact that COVID had since this is 2021 data. However, we still see how NCDs are still among the most frequent causes of death. As you can see on the right side, for the non-Latin Caribbean sub-region, where stroke, ischemic heart disease, diabetes are still leading causes of death. In terms of premature mortality due to one of the 4 main NCDs, as you can probably guess, we are not reaching the target regionally. We see some decreasing trend. However, that's not enough. The premature NCD mortality was reduced by 8%. Very far from the 25% that we're aiming to. So additional efforts need to be made, and only a handful of countries are on track to meet the target. In the CARICOM region, as you can see, 9 out of the top 10 countries in the region with the highest premature mortality are Caribbean countries. So this means that in most countries, a 30-year-old person has over a 20% of chances of dying from one of the 4 NCDs before reaching 70. This really highlights that there's a lot to be done. These are premature preventable deaths. So even though the trend is decreasing, we see that in the non-Latin Caribbean, for example, still we have higher levels of premature mortality compared to the region of the Americas. In terms of the GMF, the Global Monitoring Framework targets, we can see that except for tobacco use, for all targets, we are not reaching them. Even in some cases, we're moving in the opposite direction to targets regionally. So that's the case for insufficient physical activity, for diabetes, and for overweight and obesity. And I will share a few examples of some of these risk factors. I will move fast in the interest of time. But you can see on the screen, and this information is public and you can access it online, the prevalence of overweight for the CARICOM countries, and on the right side, the obesity. And we can see that obesity has been increasing in the past 3 decades non-stop in all countries. And in most countries in the Caribbean, half of adults are overweight, have overweight. So these are really important figures to take into account. On insufficient physical activity, in the region, we know that almost 36% of adults do not engage in sufficient physical activity, and this has been consistently higher among women than men. And several Caribbean countries are above the regional level. And again, we have seen an increase in this trend in almost all countries in the Caribbean. For diabetes, you can see the prevalence of diabetes. Regionally, it's at 13% based on the latest 2022 data. And in Caribbean countries, for all of them, the prevalence is even higher than the regional average, with some Caribbean countries having the highest prevalences in the region. And also we see a lot of room for improvement in the treatment coverage for diabetes. Moving on to hypertension, in the Americas, we know that around 35% of people are living with hypertension, and only 1/3 have their blood pressure controlled. That's the dark green bar that you can see on the right side. So this really highlights that more can be done to improve the coverage of treatment and also the diagnosis, which we see that there's a huge percentage of undiagnosed people with hypertension. So I want to share finally some information regarding the Progress Monitor 2025, and this is a report that we have released recently on indicators that are related to the NCD best buys implementation. So as you can see, and I don't expect you to see the detail of this table, but what I'm showing here is that we see a lot of red. So if we focus on the Caribbean countries, we can see that there's some green, so we can see what the areas where progress have been made are, but we have still some areas for improvement. So in terms of NCD surveillance capacity and NCD action plans, we can see that there's still many countries that need to align their targets with the GMF, for example, and there's a need for more surveys to report on NCDs and risk factors, and also that action plans need to be updated. Some countries have them, however, there's a need of updating or developing NCD action plans in the Caribbean countries. On risk factor policies, there has been progress on tobacco control policies, especially on smoke-free environments and health warnings. However, we urge countries to establish tobacco taxation and bans on advertising that seem to be the areas where less progress is seen. And then the policies on reducing harmful use of alcohol are lagging. 5 countries have made progress in increasing excise taxes, but still there's a lot to be made to address the harmful use of alcohol, especially through fiscal measures. On healthy diets, this is probably the weakest area with little progress in terms of front of package labeling, food reformulation, and there has been some progress related to healthy diets, but still there's a lot to be done. On physical activity, a few countries have made progress on this. However, still most countries have no physical activity campaigns. And finally, almost finishing, so on NCD guidelines, as we all know, implementing evidence-based guidelines for diagnosis and treatment of NCDs is key for any national NCD program, and only 3 countries have achieved this. We are in a better place with availability of chronic respiratory disease medicines and technologies, and still a lot to be made regarding HPV vaccination coverage. So last slide. And I'm sorry that this has been very fast, but I have a lot of information to share, and all of that is available. We know that there has been some progress in NCDs. However, there's a lot to be done, and we know what that is. Of course, accelerating the implementation of best buys to create health-promoting environments with attention to social determinants of health and community engagement. Also, strengthening primary healthcare to ensure equitable access for NCD diagnosis, treatment, and control. Securing sustainable financing is key, and also adopting multi-sectoral policies to address the major risk factors for NCDs. And last but not least, strengthening data and surveillance to monitor progress and facilitate accountability. So that is all, and I thank you again for the opportunity to share all this data. And just to remind you that all of this information and a lot more are available online in our latest publications. So thank you very, very much.
Thank you very much, Dolores, for that very full presentation on a global perspective. There were some greens there in the region, but also a lot of red, right? So that we do have a lot of work to do. And moving from the global perspective to the regional perspective, where we still have a lot of red, I'm now going to invite Mrs. Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition, who I met this morning, to deliver her remarks for the webinar. Maisha, go right ahead.
Thanks, Kenneth. And I want to thank Dolores for that presentation. That obesity slide was quite staggering. And I wanted to just let people know you can go on our website and also see the 2024 version of the Port of Spain grid for regional data. Thanks to CARICOM for that. So you heard from Linda at the level of the NCD Alliance around the advocacy that's happening there from civil society at the global level. And I want to share with you now what HCC is doing in the Caribbean at the regional level. So, and before I get into this year, the HLM4, I wanted to look back at the HLM3 in 2018, the most recent high-level meeting. And Dolores would have mentioned that in her presentation. And so what did civil society working with partners, CARICOM, PAHO, CARFA, the university do back in 2018 to mobilize the Caribbean around the high-level meeting? Well, we had a major meeting there, and you can see many of the actors who are on this call in that photo. We put together guidance for the Ministries of Foreign Affairs. As you would have heard from Linda, the negotiations are happening in New York through our permanent mission. So it's really important that they are seized of the issues of NCDs and they understand what the priorities are. We came up with a set of regional priorities that we agreed on across as a group. There were 9 priorities, and we had a campaign slogan around which we were galvanized from the global level filtered down to the Caribbean level. And this is what we used to push for these priorities throughout the process. We were successful in getting heads of government's attention, and in the 39th regular meeting, the communique out of that meeting endorsed the priorities which we had agreed on throughout the region. They commended civil society. This was a real success. We also had participation in the multi-stakeholder hearing. So over in New York, and you'll see Sir George Allain there, Dr. Karen Seeley, who's been a real champion in this process over many years. Sir George, who was one of the catalysts for the global these UN high-level meetings back in 2011, and then we also had this campaign, which I mentioned to you again, really trying to get heads to attend that high-level meeting. And Kenneth would have mentioned at the outset of these 5 asks, and one of these asks we had was to attend the meeting. So this is what we did back in 2018. And one of the key asks, as Kenneth mentioned, was to, at the high-level meeting, what did we want? We wanted a side event, and we did have a high-level side event. And you heard Director Roy say that this is in the works this year for 2025. We had very high-level representation at the side event. And throughout the high-level meeting, we also had strong civil society representation. So bringing us back now this year to 2025, and you would have seen this slide developed by the NCD Alliance. We adapted it to reflect the Caribbean perspective on this. And so you'll see Caribbean actions across the bottom, and also noting importantly that one of the stewards of this process is the co-facilitator from St. Vincent and the Grenadines, as mentioned by the Honorable Minister of Health of St. Vincent, and that's Ambassador King. And importantly, throughout the negotiation process that you would have heard Linda mention, CARICOM acts as a block, and the lead of the negotiating process is St. Kitts and Nevis. CARICOM sits within the broader G77 block, and the co-negotiator, one of the co-negotiators for that process is Guyana. So real strong Caribbean representation in this negotiation process. At the regional level now, we've had a number of activities or milestones over this process. HCC developed the priorities, which I'll talk a bit about in a moment. We had a number of update meetings, and then we've had key political meetings across this process in which we've tried to elevate the high-level meeting on those agendas. So HCC's priorities were developed in consultation with our member organizations back in November of 2024, and then shared with regional partners in which they expressed support. And then they were published, and they've been used since then to advocate around this meeting. There are 12 priorities, and many of you have seen these already. They're available on our website, so I'm not going to go in any detail, but you can see them here. And this is what we've used to advocate over the process of the negotiations. We have a dedicated webpage, which has a number of resources. And so once we developed the priorities, we started to get engaged in the process that was happening, the preparatory process. And as was done in 2018, we participated in the multi-stakeholder hearing in New York. And this is an opportunity for stakeholders to feed back to member states around what their priorities are at the outset of the negotiation process. And you'll see lovely Diana here. She was there. She participated in a side event. We have Ms. Stephanie Whiteman, who was representing the Caribbean and the Global Mental Health Action Network, and she had a major role in the opening plenary. HCC, I was also on one of the panels in the plenary, and we had participants. This is Maria O'Brien from Mindwise in Trinidad representing mental health. So really strong Caribbean representation at that hearing. We also took the opportunity to meet with the missions. I mentioned just now, as you all know, these are the folks who are leading the negotiation process. In particular here, I want to shout out to Sonia Bodie. She is the lead negotiator for St. Kitts. So really doing the hard work. And then we have here Abasadi Hazelwood and the ambassador here for Guyana. Guyana is the co-negotiator. So a real tough job they have leading the G77. And then acknowledging here the tremendous stewardship of Ambassador King and Ambassador Mayes throughout this whole entire process. So we met with Barbados, we met with Guyana, and we really tried to establish those relationships to support the advocacy throughout the process. We've been participating in the negotiations, trying to input at every stage. I will say one success was there was a period where it was touch and go whether or not we'd have SIDS language in there, and CARICOM fought quite strongly, and that language now is situated within even the current version of the Rev 2. It's not as strong as we'd like it to be, but it is mentioned and acknowledged, and that's going to be important moving forward. The Rev 2, as Linda just mentioned, we're at a critical point now because the document has really been significantly watered down. This is a lot of language, a lot of text here, but we've just sent our most recent comments to the member states, and I'd like to thank NCD Alliance for the really in-depth deep dive they do of a very long document, which they compare different versions and they compile comments, and it really assists us at the regional level in our feedback. And so I've highlighted here in orange kind of the key takeaways. And really, the HCC expresses its deep concern and regret, because ultimately what we have now, despite the efforts of a relatively strong first draft, is we have a token political document, which in its current state cannot and will not adequately serve people living with and at risk of NCDs, as it really falls significantly short of its potential to accelerate global, regional, and national NCD action. So really, there's a need for urgent action. We've seen across, partners across the globe really voicing this urgent need to act and influence member states to try and strengthen it even at this late stage. The key areas, which Linda would have mentioned, which I will emphasize, around the tracer targets, fiscal policies, and these are really important for us as CARICOM member states, and we've seen these are very much embedded in the 2023 Bridgetown Declaration on NCDs and Mental Health, very strong language across all of these areas. We've seen a dilution of safeguarding around conflicts of interest, a dilution of meaningful social participation, financial protection, access, climate resilient health systems, very important for us. That has also been significantly diluted. So real work needs to be done at this point to strengthen it and get it back to a strong document, if at all possible. On the regional level, we've been really trying to build public and policymaker support. We've had a number of campaigns, which I hope you've all seen, Time to Lead, highlighting Caribbean leaders. And we've also had most recently Time to Lead again. These are video spots where we're really trying to get members to explain why each of the priorities are important to them. And you'll see more of those over the coming months as we approach the high-level meeting. At the political level, a few successes, thanks to CARICOM and their work with us to get the Ministry of Foreign Affairs guidance onto the agenda of the COFCOR meeting, which was held in May, and it was ultimately on the communique, which meant, from speaking to one of the negotiators in New York, how important this was so that it could be used as an important negotiating tool for the permanent missions. Also wanted to acknowledge Antigua and Barbuda for raising it as an informational item on the agenda of the COTED meeting held earlier in June. Coming to the heads of state and government meeting, I mentioned to you that back in 2018, we were really successful. We put out our asks. We asked heads of government to endorse in the communique. Unfortunately, this did not happen this year around, despite sending out an open letter, reaching out through various channels. The ultimate communique out of the 49th meeting did not mention NCDs or the high-level meeting. So we've got two X's here. We did send a letter to the heads expressing our concern, but saying, there's still time. There's still these outstanding areas, which we've heard from other presenters. We would like CARICOM to have a lead role, at least one of the multi-stakeholder panels at the HLM4. We heard from Director Roy that a high-level side event is in planning stages, so that seems like a go. And then the final ask, which is very important to us as civil society, is that member states make room on their delegations for a civil society or a youth representative. So what are our next steps? We will continue the HLM4 advocacy as we approach the high-level meeting, encouraging heads of government to attend the meeting, encourage them to continue to participate in the negotiation process, support as much as we can over this final stage of the negotiation process. We hope to participate in the side event. And then post-HLM4 is where we really pull up our sleeves and begin the work, the hard work of translating whatever that document ends up looking like into our own CARICOM roadmap. Now, we as civil society will create this, but we hope to work with partners, CARICOM Secretariat, PAHO, CARFA, again, as we always do, to come up with some priorities. And you'll see that I've written here priorities amongst priorities. We really do need to identify what are the highest return on investment, best buy actions we need to take between now and 2030 to accelerate action. And so that when Dolores comes back to present in 2027 and 2030, we're seeing a real turnaround in some of that data. We're seeing much more green. And we hope to develop time-bound targets as part of this roadmap and develop a communication campaign. As I close, I just want to reiterate and thank all of the civil society actors who've been working with us at the national level over the course of the past few months, working to come up with the priorities, working with their governments at the national level. And kudos to all the work that civil society has done. And thank you to all of the partnerships that we've had with PAHO, with CARFA, and of course with the CARICOM Secretariat. We'll continue to work hand in hand with you. I'm really excited for the rest of this webinar. Looking forward to hearing the panel and talking about solutions as we move forward. Thanks very much, Kenneth.
Thanks, Maisha, and thanks for bringing us back on time as well. So I noted your comment that the document has largely become a political document, and that's something we all need to bear in mind as we move the discussion forward, including the panel discussion. So we're going to move right in now to the Mentimeter. I always see Mentimeters as possibilities to get some physical activity. If you are at home, you can stand and get some steps in. And I'm going to hand it over to Doriel Quinton, a project assistant here at ACC. Doriel, go right ahead.
Thank you, Dr. Connell. I hope you can hear me well.
I can.
Great. So we prepared a few quick Mentimeter questions to get a sense of how everyone's viewing the region's progress and priorities around NCDs. So I'd like to invite everyone to participate by scanning the QR code, or you can click the link that I believe has been dropped in the chat for a Menti. So I'll give person a quick second to join the room, and once you've joined, you can give us a thumbs up. Great, we're getting a lot of thumbs up.
All different colors.
Great. So as we look forward to the 4th UN high-level meeting, we also need to take a look back at our political commitments, and one of them being a very important one was the Port of Spain Declaration in 2007, where CARICOM has the government acknowledged NCDs as being a major threat to health, development, and economic progress, and also made commitments. So with this question, really want to ask everyone, how would you rate the Caribbean's progress on NCD prevention and control since the 2007 Port of Spain Declaration? So we're seeing the majority fair, mixed progress. That is fair. We'll give everyone a couple more seconds. And I'll pop the QR code in case you still need to scan the QR. Right, so I think we're seeing that by far we're having mixed progress. Okay. So we'll move on to the next question. And as we know, the 49th Heads of Government meeting was held earlier this month in Jamaica. And as Maisha mentioned, notably, there was an absence of any language around NCDs in the communique. So we want to hear from you. What do you think are the top reasons for the silence on NCDs at the recent Heads of Government meeting? And this is a 100 points question, so you can allocate points for each category. So you can pick multiple, but allocate the most points to which one you think is like the top reason for the silence. It's probably going to take some time, a little bit of time for everyone to allocate their points. We have lack of strong political will, decay of knowledge. Decay of knowledge is up there right now, 25%. But lack of political will is beating it out, 36%. Right, so we're seeing in our top three, lack of strong political will, decay in knowledge of the urgency of NCDs and mental health, and multiple more urgent priorities, for example, crime, economy, etc. So those seem to be our top three. Yeah, I'll give persons a couple more seconds. So 31, 22, 18%. So we're seeing those top three and they're sticking there. I think we can move on to the next question. Right. So now looking towards the fourth UN high-level meeting, we want to know from you, which of the following actions do you think CARICOM leaders should prioritize? So you can rank these. So we have a public commitment to attend the UN high-level meeting, to host a side event, or supporting CSO and a youth representation in the national delegation. Right, so we're seeing those rankings. Of course, we'd love to see all. But we're seeing supporting CSO and youth representation at the top and public commitment. Yeah, those seems to be our top rankings. I'll give persons a couple more seconds to get their votes in. But it seems pretty steady now, okay, which is great. We'll move on to our final question, which is an open-ended question. We want to hear from you. What are, in your opinions, the potential consequences if CARICOM leaders do not attend or meaningfully engage at the 2025 UN high-level meeting? Since this is open-ended, I'll give persons a couple seconds to gather their thoughts. As we know, having that Caribbean representation is very important. We have one person saying none. Now that's a valid argument. We also have one saying Caribbean influence will be lost if we don't have that representation there. That is true. So the loss of representation and NCD advocacy, continued lack of interest and political will to address NCDs in a meaningful way. And the region will remain behind with increasing levels of NCDs, continued lack of knowledge, stalemate, health advocacy will be stalled, continued regional inaction, decrease in advocacy, and having our Caribbean issues not being raised, and lack of opportunity to really move forward the NCD agenda forward. So we have a lot of responses here. And I think this is something for, our panelists to also keep in mind, and for everyone on the call really to keep in mind. So thank you very much for your interaction, everyone. And with that, I will give the mic back over to Dr. Connell.
Thanks, Dorian. Thanks so much for that. I'm hoping to see that last slide up during the panel discussion, if at all possible. So I'm going to pass the baton on now from one young person to another, through the chair, of course. Ms. Kayla Wright is the program officer at Jamaica Youth Advocacy Network, and we're going to hear the youth voice just before we get into our high-level panel discussion. So Kayla, go right ahead.
Thank you, Dr. Connell. Can everyone hear me? Yes. I'm assuming yes.
Clearly.
Okay, good morning, everyone. I'm Kayla Wright. I'm giving the youth perspective. I'm 25 years old, so I think I'm still there. And as Dr. Connell said, I am the programs coordinator at the Jamaica Youth Advocacy Network. And I wanted to start off this testimony by saying what nutrition advocacy means to me, because it is deeply personal. I grew up loving my Uncle Earl's cooking. He's an incredible chef. And I love my mother's cooking, but nobody to my uncle. And he's hypertensive and also has diabetes. And as a child, seeing someone you love grapple with these realities is very hard. Over time, I realized, though, that my family situation isn't unique, because 1 in 3 Jamaicans is hypertensive, 1 in 8 is diabetic, And these aren't just numbers, you know, they're families, they're communities, they're us and people we love and care about. So through my journey in nutrition advocacy, I've learned that NCDs are the leading cause of death in Jamaica and across the Caribbean. And this is why I feel compelled to play my part in shaping a Caribbean where health is valued over profit, where consumers have clear information about what they're putting in their bodies, and where the healthier choice is the easier choice. You know, as young people, we're targeted by aggressive marketing of unhealthy foods and sugary drinks and alcohol, even tobacco, and the habits formed in our teens and early 20s set the tone for the rest of our lives, believe it or not. And it's true. And if we don't have early intervention, we're essentially watching a new generation inherit the same NCD burdens that we're seeing today. So I think it's very safe to say that I represent a generation that wants to live long, healthy lives, free from preventable diseases. Climate change is another thing, but that's for another time. But this requires action now, from policy change to strong community initiatives to legal reform, because we're not just future leaders. And I think I've grown a bit annoyed at that saying, because we're here today, we're ready today to create and co-create solutions. And I think, as Diana had said earlier, and I'm remembering just now, we shouldn't just be invited to speak occasionally, but hold permanent positions in the decision-making process. So the political declaration is an important step, and I think we can welcome the emphasis on mental health and regulations of unhealthy marketing. But truthfully, there's still gaps, especially when it comes to youth engagement, because we cannot just be consulted at the end. You know, young people need a seat at the decision-making table. Otherwise, it's just tokenistic, you know, and not only as advocates that are just nagging in people's ears, but as partners who shape and design and monitor policies that affect us, because NCD prevention begins with us. So I do welcome the inclusion of, I think we as youth can welcome the inclusion of strong regulations for marketing, because for far too long, the food industry has aggressively, I'm using that word again, aggressively promoted sugary and ultra-processed products to children specifically, and this shapes their preferences before they can even read labels. And this is very unfair, and it's definitely unhealthy. And shameless plug, I co-wrote a letter to the editor calling up manufacturers as duty bearers, because we always say it takes a village to raise a child, and that village has to include manufacturers, whether they like it or not. So we do need to push for policies that protect children and empower families, from front of package warning labels to even restricting the advertising of unhealthy foods, because healthy environments must become the default and not the exception. And I said that I'm good on time, which is great, but I'm ready to close, because I want to say, as we reflect on the progress since the Port of Spain Declaration back in 2007, I was 7 years old then, and we look ahead to the high-level meeting, I want us to ask ourselves what kind of Caribbean or what kind of CARICOM we even want for the next generation. I personally want a Caribbean where health is the priority, where we're living free from preventable diseases, where our children are growing up strong and well-nourished, and where young people like me are not just voices in the background, but leaders of change. So, and it has been repeated earlier, I think, that we must bring in everybody to deal with the issue, and that definitely includes you. So that's my testimony. Amen. Okay.
Thanks, Kayla. I really enjoyed that. Thank you so much for that contribution. You're absolutely right that you know, it's not just tokenism having youth as part of the agenda, but you need to be an active voice there. And of course, at 25 years old, you still are a youth. I'm twice that, and I still consider myself one as well. So let's move into young people at heart with our high-level panel discussion and our panelists. I'm going to be moderating this panel, and I'm going to ask all of the panelists to turn their cameras on at this point in time. I'm, as well as we get their photos up on the screen? Okay, great. We have everyone's photo up on the screen, but I will highlight the panelists. Okay, so many of them do not need an introduction. In fact, all of them don't, but I'm going to go ahead anyway. So George Aline is PAHO Director Emeritus of PAHO and HCC patron. Dr. Joy St. John is Vice Chair of the Technical Advisory Panel of the Pandemic Fund, hosted by the World Bank, and the former Executive Director of CARFA. Welcome, Joy. And Dr. James Hospitalis, Executive Director of Earth Medic and Earth Nurse. And I can't believe, James, we actually left off that you are also a Director of the Healthy Caribbean Coalition. So James, welcome to your webinar as well. Dr. Sante LeBlanc, the Medical Director, Commercial Determinant of Health, CSO Voice. And finally, to shift the median age of the panel, Daniel Walwyn, who is the lead Healthy Caribbean Youth Advocacy Officer here at HCC. So thank you, panelists. So I'm going to start by setting the scene. The high-level meeting, let me just see from a show of hands, because I know we've had a lot of speeches and presentations, but from a show of hands from the audience, how many of you have heard of HLM4 before this webinar? I have to admit, I mentioned this to a group of medical students yesterday, and they were totally clueless. And well, they were clueless about the Port of Spain Declaration as well, which suggests that there is still a lot of work to be done. I'm seeing, let me look at, Daniel, are you looking at the, Doriel, sorry, are you looking at the chat?
Four hands, right?
Okay, all right. HLM4 comes really at a critical time. It's only 5 years shy of the SDG goal target in 2030, and it's 18 years post the Port of Spain Declaration of CARICOM countries, and we are grossly off track for those targets, as evidenced by the WHO Progress Monitor, which we saw earlier in the presentation, the 2024 Port of Spain grid. And if the recent conference of the heads of government meeting held in Montego Bay just last month, earlier this month, is an indicator of political will, notwithstanding the Minister of Health from St. Vincent's support this morning, we are really in a troubling state. And I want that to really sink in. We cannot just move ahead based on legacy, but we actually do need sustained political will. So in the stark contrast to 2018, when, as Maisha said, CARICOM heads committed to attending HLM3 and actually endorsed the regional NCD priorities for action, the communique, and you can just Google communique CARICOM heads of government meeting in Montego Bay, and you can read it for yourself. You will note that there is no mention of NCD's priorities in that communique. It is absolutely a deafening silence. In the region where 8 out of every 10 deaths are caused by NCDs, the communique does mention things that are also important: cricket, CARIFESTA, the cost of living, and regional travel, but it does not mention NCDs anywhere in there. We have increasing numbers of Caribbean children who are overweight and obese. People living with NCDs continue to struggle accessing essential medications and technologies. And CARICOM, really, we were considered the global leaders, but we cannot just live on a reputation. So let's begin to unpack it by looking back. And I'm going to invite all of the panelists individually to reflect on the key achievements and the challenges, because there were some challenges that we can learn from and build upon as we look forward to September 25th. I'm going to start with myself. One major accomplishment has been the HEARTS program. The WHO PAHO Hearts Initiative, which is now in more than 33 countries, 17 of which are in the Caribbean region, as a major intervention for the management of hypertension and NCDs. And so I'm going to pass the baton over quickly, because I'm not a panelist, to James Hospitalis. James, what do you think are some of the key achievements, and how can we learn on them and build towards moving forward in 2 months' time?
Thanks, Ken, and hello, everybody. Key achievements. Oh, we held the Port of Spain Summit. We sort of led the world, and we can say that proudly. Sir George was our big champion at the time, and we had a collaboration between PAHO and CARFA and UWI and others, which is noteworthy. But how to keep that up? I had the privilege of being involved in that in 2007, and I've been to all of the HLMs, 2011, 2014, 2018, and I just looked at the communique. And as you were remarking, I felt like a cold water shower when I looked at that communique. I felt shocked that the group that had led this didn't take what seemed to be an easy win. Just keep going. Health is meant, not only NCDs not mentioned, health is mentioned 4 times. Climate change 19 times. Now I do champion climate change, and I think that's part of the way forward. Crime 17 times. Food and nutrition security 11 times. Health not at all. So we could be upset with that's not a good achievement. Or we could say, how do we insert ourselves into some of these other agendas that the heads are paying attention to? And how do we bring health back and have a different scorecard? I think we've made some progress where things are within the control of ministers of health, increasing coverage, increasing funding, because although we say, maybe it's not a priority as reflected in the heads, it's a priority in budgets. Health and education are the biggest components of any CARICOM government budget. But how do we make it more of a political priority? Alafia Samuels, myself, Sir George, others wrote a paper on this some years ago. How did we manage to elevate this as a political priority? And I think some of those things are worth revisiting. What is the priority? I'm struggling because I keep seeing the things we have not yet achieved that we set out in the Port of Spain Declaration to achieve.
I'm going to let you think on it and pass the baton over to Joy. But interestingly, I was in Trinidad recently, and one of my colleagues at a medical conference said, in an article he wrote, how do we make health political again? Because that seems to be the problem. It's no longer political. Joy, over to you.
So some of the improvements since the original Port of Spain Declaration, and I'm going to say it again, it's time that we have another summit on NCDs, and we have the 20th year coming up, so we can work towards it. But a lot of the achievements, and I will speak to some things that happened while I was at CARFA, have been systemic and predicated on what the Port of Spain Declaration wanted. I think of the Caribbean Moves, which is a way of galvanizing communities to pay attention to their health and be more physically active, and to have, therefore, supporting environments that allow them to do this. Another achievement has been the formation of a network of mental health, NCD, and nutrition advisors. And there has been empowerment of those advisors by training. And most recently, in collaboration with PAHO, CARFA would have staged a meeting which allowed for the integration of NCD plans into disaster planning. If you're talking about hitching to a strong wagon, that is an example. And then another, and that whole thing about empowerment also is borrowing from the Port of Spain Declaration. And the third thing was the implementation of updated NCD guidelines, diabetes guidelines, and empowering the community, the persons with diabetes and their caregivers, in understanding and using those guidelines. So again, there is the empowerment of people, and guidelines are a big part of the NCD. But the challenge is, the big elephant in the room is the lack of funding. And then I'll speak up on that later.
Thanks very much. I'm going to hand the baton over to Sir George for his comments on the achievements that we've made and what can we learn to build on moving forward.
Thank you very much, Kenneth. I'm going to be very naughty, and I'm not going to speak about the achievements. I mean, it is good to pat ourselves on the back and say we've done so well. I'm going to talk about what we should do now and what the gaps we should fill now. When I thought of this webinar, I thought that this webinar was useful because it took place within the context of the upcoming HLM, and it would give an opportunity to focus the public in general on the HLM. I too was disappointed, grossly disappointed by the communique. And there should be finger pointing on this. Who is responsible for setting the agenda for the CARICOM heads meeting? And if on a year in which is a HLM, if on a year where the CARICOM is going to celebrate leadership in one sphere, that the heads cannot even mention health, I think that is something for which we in the Caribbean, which Caribbean nationals should be very, very ashamed. But I take the point that the colleague from NCD Alliance made, and this is not a cliff edge occasion. But we're near the edge of the cliff, and I'm going to suggest the following. I'm going to suggest as a result of this webinar that HEC send an urgent communique to Ambassador King and to Guyana saying, as a result of this seminar, we would make a last-minute plea to you to include some of the things for which HEC has articulated. So specifically recommendation today, as a result of this webinar, to communicate with Ambassador King, to communicate with the negotiator from Guyana, expressing that our last hope, our last-ditch hope, is to get some of the things we need to get into the declaration. And we in the Caribbean, we who participate in the webinar, we would regard it as a slap in the face of those who participated in the 2000 and the high-level meeting not to have a stronger declaration. But going forward, I want to make three other suggestions. I say, forgetting about the communique now, and the fact is not a cliff edge, and what we have to look to do as after the declaration, because whether the declaration is strong or weak, we know what some of the things that have to be done. And there are three things I'm going to suggest. One, and I'm repeating myself now for the nth time, we have to stop focusing so much on mortality. We have to stop focusing so much on the dead. And we have to focus a lot more on the people who live with NCDs. And we have to make it, and we don't have to, and we should avoid hiving off the responsibility to the voices of people who with NCDs and make it a responsibility of the NCD community as a whole to speak of the persons who, if there are 1 million people in the Caribbean with hypertension, when you see the great, well, I was ashamed that there is no Caribbean country that reaches the target for tobacco taxes. None. And this is not a subject, it's not a something which we don't all agree. And we have to focus on our public advocacy for something like this. One is mortality. Stop counting the dead. I shouldn't say stop counting the dead, that's terrible. I want to be counted. Stop counting the dead. But let us focus additionally on those who are living with NCDs. That's one. The second point I'd like to make is this. I would suggest that we focus on the media. And Kenneth, you mentioned that earlier on. And we focus on the media in a different way. We regard the media as informing. I think we should strive to make the media a part of the conversation. That media, reporters get NCDs too. media moguls get NCDs too. We want to see them as being involved in the thing, not as a bystander, passive bystander, but being integrally involved in the commitment to NCDs. And the final point I'll make is this, I'll just go around. I know James is going to talk, and James has already mentioned the economic aspect. We have to, in a sense, if not change the rhetoric, but focus on the economics of NCDs. Why, in fact, NCDs represent an existential threat to the economic survival of the Caribbean countries. The NCDs reduce the quantity and the quality of our human capital. All of the Caribbean countries, with the exception of Guyana, depend for their wealth on their human capital, And one of the greatest destructors of human capital is the NCDs. And we have to frame somehow that rhetoric has not, that message has not surfaced with the accuracy, with the poignancy, with the sharpness in the Caribbean as it should have. And I'm going to stop here. So another reason for doing this, Kenneth, is this. The Prime Minister of Barbados is co-chair of the Commission on Fiscal Measures. And if Barbados is the co-chair and that recommends raising tobacco taxes as a win-win, taxes on tobacco, alcohol, and sugar-sweetened beverage as a win-win situation, why are we not trumpeting that throughout the Caribbean? Why are we not? And so I think that this is something after the cliff. I would say after we jumped off to the cliff, but even after the declaration, these are some of the things we want to do. Speak up more about the living and don't leave it only to the people. Engage the media and frame the argument for, say, not in a different way, but in an additional way. Thanks.
Thank you very much. It's interesting that you said stop counting the dead. Yesterday I had lunch at another fancy restaurant, like one of the panelists on here, but in Barbados, and the person serving me said, "You're the NCD man in Barbados. Why y'all like to talk about dead people so all the time?"
See, he or she got the message. I hope it was a she that got the message.
She got the message, yeah. And so it struck me when you said stop counting the dead. Asante, over to you. What are your comments on, what are some of our key achievements?
I'm going to speak more. First of all, thank you for having me and all protocols observed. I'm going to speak from the CSO perspective, the grassroots perspective, and a GP perspective. To me, from the grassroots perspective, we have made impact in terms of our education and some empowerment of the communities. And you're seeing a positive change where our public and the people are going out to get checked and to look after their health. The major hindrance, however, is economical, is financial. This is where we're seeing, while the government say you have moves, you have hearts, you have all these things, but then it's not accessible to the common man. Then they may be working, have good jobs, and they have insurance. So I want the insurance companies to hear this as well, because you have a preventative benefit. You know it's not enough to cover what needs to be covered, but not only that, when we access your preventative benefit, which will in fact bring down your claims generation, you increase the premium to the person and to the organization. So it's a double whammy. Looking after yourself causes more grief, and so you can't afford insurance anymore. So all of this is to say that we're in a conundrum where we talk a talk, but we don't walk it. And this is as a region, as nations, and internationally. Most importantly for the Caribbean region, and I must say, we need to remember our forefathers. We need to remember who made us CARICOM. We need to remember what they stated from a long time ago. And Dr. Hospitalis, you talk a lot about Earth Medic and Earth Nurse. We need to get back to our Earth. We need to recognize that we in CARICOM can, if we truly want to strengthen we can be our own region. And the CARICOM leaders that are listening to us or get this message need to take that to UN in September and show them that we don't only have to depend on the first world. And our hindrance is that we're not moving forward as a region and togetherness. And we need to be much more holistic. If we fall off that cliff, Sir George, we will have a parachute, and the parachute is us and continuous education and empowerment to make our region a better region and a healthier region. Yep.
Thanks, Asante. Thanks for that. And I know that everyone is sticking with the cliff analogy. Danielle, you don't have to. You can save us all with a parachute. But can I just hear your thoughts on achievements? Or you don't have to state any achievements. You can just say, well, we've done nothing right from a youth voice.
Thanks, Dr. Connell. I do think we have some achievements. And so I do want to start on the point of youth. We have seen, I guess, not an achievement, but definitely the challenge. We've seen more young people living with non-communicable diseases and being impacted by non-communicable diseases. But at the same time, we are seeing more young people mobilizing around NCD-related issues. We would have started Healthy Caribbean Youth, launched in 2020, a group of young people who are very interested in supporting a healthier Caribbean. I have to shout out the Barbados Childhood Obesity Prevention Youth Advocates. Right now, they're mobilizing youth and raising awareness about the importance of healthy school food environments in Barbados. We would have had an initiative called Hope for the Future, bringing together young people from across all CARICOM countries to call on governments to accelerate healthy school food policy. So a lot of youth-related work. We've also been on the youth side, really trying to build and strengthen strategic engagement. So we have had great engagements with CARICOM youth ambassadors and youth parliamentarians. And I have to say, Dr. Connell, that this would not be possible without leaders like all of you on the call who have prioritized and valued youth leadership and also valued intergenerational leadership. So I just want to thank again all the allies for your continued support. And I have to add too that the mobilization that we've been seeing of young people is also possible by the financial and technical investment in young people and providing platforms for them so that all of the actions that I mentioned before have been possible. A big shout out to the Global Health Advocacy Incubator for what you've done over the last couple of years. On the policy front, because I am wearing my advocacy officer hat, we have seen Barbados increase their sugar-sweet and beverage tax from 10 to 20%. And the sugar-sweet and beverage taxes are being considered in other countries like Antigua and Barbuda, with funds potentially being earmarked to health promoting efforts. And we just heard from Sir George on what's happening with fiscal policies and the role that CARICOM can play. We heard from Linda that we have seen a weakening in this language in the political declaration. So it's so important that CARICOM leads again on the issue of fiscal policies. We've seen school nutrition policy progress, implementation in Barbados, and then really great advancement in Jamaica and other countries. And I have to note, we haven't mentioned it yet, but on the mental health front, we've seen several countries across the region, I would say probably post-COVID pandemic, really revisit their mental health legislations and prioritize a shift in culture around mental health. And we have to note that a lot of this dialogue has been driven by civil society and young people. And I have to give a huge shout out to UNICEF and Let's Unpack It, a key organization based in Barbados, for building the capacity of youth in this space. And the final thing I'll say, Dr. Connell, is around commercial determinants of health. I know we're going to get into it throughout this discussion, but I think a win that we have to acknowledge and I lean on, especially right now, is that we do have the 2023 SIDS Bridgetown Declaration on NCDs and mental health. And this is being recognized globally as a first of its kind document. It outlines a commitment to addressing commercial determinants of health and conflict of interest. And I think you will understand by the end of this conversation, if you don't now, how important this topic is in order for us to advance NCDs.
Thanks, Danielle. And let me just say for the audience, because many of the audience may not be aware of the tremendous role that HCC Youth plays. I mean, you might not even be on Instagram. Some of you on the call I know or WhatsApp me probably don't even know what Instagram is, but you have been so active that it is incredible. Sometimes I tune in on a webinar on a Friday evening and I think, this is a Friday evening. These young people are seriously on a webinar on packing NCDs. I mean, it almost makes my experience as a young person not too long ago seem as if I did nothing, right? But so congratulations to you. I want to move on to the next topic of prioritization because we don't have limitless resources. We are resource limited landscape. And we do need to focus our energy and our resources, not just money, but our resources in general, including human capital. So, Daniel, I'm going to let you lead on this now. What do you see are some of the ways we can focus our energy to achieve the greatest impact?
Thanks, Dr. Connell. And you know what? This point that I'm going to make has already been reiterated during the webinar so far, and it's the prioritization of meaningful engagement of persons living with non-communicable diseases. Well noted, Sir George, on your point, but the spaces don't exist right now. So we really do need to create institutionalized spaces for CSOs, persons with lived experience, and young people to participate in NCD decision making. We need to really think about, as Kayla would have mentioned, and we were chatting ahead of this webinar, spaces where these folks can contribute and have real decision-making power. So Jamaica Youth Advocacy Network, just going to draw on this very quickly, they would have had a consultation recently with youth across Jamaica to develop their manifesto. And this was one of the calls that they demanded, and I think, again, is applicable across our key populations. So this real decision-making power, and we also need to consider greater transparency and feedback loops from government bodies to these key populations. So really, really focus on this, the mechanisms for engagement. We have to understand that whenever we're thinking about people, the people closest to the problem are also the people closest to the solution. So really do need to keep that in mind. And again, I just want to reiterate, so mechanisms for engagement, but I have to reiterate the conflict of interest, commercial determinants point, and think about how we can integrate conflict of interest meaningfully into our governance systems. We really need to think about, for example, leaning on the Bahamas, who would have integrated conflict of interest language into their recent health promotion and wellness bill, where they want to support conflict of interest policies to help interministerial coordination and multi-sectoral coordination. And the absence of conflict of interest policies, we heard what the result of that is. As Kayla rightly pointed out, youth continue to be targets of predatory marketing, even in environments that are supposed to be protected, like school food environments. We're seeing firsthand what's happening with conflict, with health promoting policies and advancing that. We've seen a significant weakening in our policies across the region, but as Linda mentioned, we've seen significant weakening of what we know to be best buys globally. And so I will on the note of time, I'll end on that, but really we need to be prioritizing mechanisms for engagement, institutionalized mechanisms, and also really need to be considering conflict of interest policies as an important tool in our toolbox.
Thanks, Danielle. Thanks. And Asante, I saw you nodding your head in agreement a lot during Danielle's presentation. I'm going to hand the baton over to you as the other young person on the panel as well. So go right ahead and what do you see as some of the priorities?
Priorities for us to move ahead positively. I actually wrote it down because I have ADHD and I go off. So I said, prioritizing food security and safety, because it's very important about the quality of food that we have regionally, because that impacts in terms of the foundation of us fighting NCDs. Prioritizing and effecting proper tobacco and vaping laws. Very, very important. Again, Daniel, ensuring that we look at that conflict of interest, looking at that interference from industry in different ways because they're getting smarter. Dr. Connell, you said about academia and, are we really doing what we need to do? On this note, I think we need to really prioritize and relook and reevaluate how we educate our healthcare professionals in the Caribbean. We need to return to empathy and core principles of what health really is. I'm a Cuban graduate. Everybody knows that. I'm very proud to say I'm a Cuban graduate. And from day one, we learn who is important, what is the definition of health, and how do we form rapport with your patients and really educate and not speak down to our populations and ensure that our goals are met. We need to prioritize and effect mandatory reporting of all our NCDs, including cancer, because I want people to remember that cancer is an NCD. Why do we need to do this? So that CAFA can really do proper research, so that we can get research that is region-centric. We need research that is appropriate to us. We need to know about our people. We need to understand how it affects us. It's not going to be a big difference, I agree. But what is good for an African American does not mean it's good for a Black in the West Indies or an Indian in the West Indies because we are African American. So we need to identify, we need to have it for our region. And I'm not a politician or anything else, right? We also need to ensure and continue our empowerment, prioritize our education empowerment at the grassroots level, because those are the people that make the decisions of who we put into power. And then if we make proper decisions of who we put into power, we may not always have this dilemma of when you get into power, you don't do what you're supposed to do. So those are my priorities.
Thanks, Asante. Thanks. And I know you said that you're not a politician, but that perhaps is why you've given us your unfiltered views and that we haven't heard silence when I pass the baton over to you. James, you're not a politician either, but I'm going to ask you to prioritize. What do you think are some of the key asks that we can start with limited resources?
Thanks, Ken. I would echo a little bit what, or a lot, what Danielle said about engaging people. You know, in the last year, I've had a cause to visit the Trinidad Eye Hospital 4 or 5 times. I've sent messages to Maisha. It is an industrial scale eye business. We've got 6 surgeons, 100 patients at any given time in the waiting room, and it's your cataract, your diabetic retinopathy, your blindness. And if you ask anybody there, do you have an NCD? They don't know what that means. They wouldn't say I have an NCD. They say I have pressure and I have sugar. And that is why I have these things. So we need to connect to that voice and have those folks realize what they have is an NCD. At the level of strategy, I want to go back to what I said earlier, that if you look at our heads communique, climate change is mentioned 19 times, economy 11 times. And we need to bring back that economic perspective because it is 3, 5, 8% of our GDP, because our social security administrations, which finance a lot of health, are drowning, they're dying. And we need to insert ourselves into the Caribbean Annual Health Financing Conference with the NCD argument. And that's something that's already on the head's agenda.
Absolutely.
Next, nutrition, which is on the head's agenda. And we need to insert ourselves into that. Food and nutrition security, that's what it talks about. So if it's talking about that, let's latch on to that. So actually my message is hitch our NCD wagon onto other moving trains in CARICOM. Single market. Food and nutrition is one, and let me come to climate change, which is
excellent
in Earth Medic and Earth Nurse, because that is the biggest threat to public health that the world is facing at this time. And it's not just me saying so, a lot of people say so. I put 2 references in the chat about papers, a paper I wrote in 2016 together with Prime Minister Tim Harris on why climate change and NCDs are 2 sides of the same coin. I stand by all those things. What has changed since then is the heat. The heat is a very teachable moment. We're going to get it in September. Let us join with the media. Let us join with our medical colleagues and others and HCC and Earth Medic and use the heat that will come in September as a teachable moment about NCDs and climate change. The climate is worsening the mortality, the morbidity, for people with NCDs, and it's a risk for all these other things, diabetes, high blood pressure, cancer, asthma. I suffer with asthma. And when I wake up in the morning, I know whether it's a bad Sahara dust day or not before I even go outside, because I could feel the tubes tightening up in my lungs. And when you go outside and you see the skies, you can't see Port of Spain properly, you know that, okay, it's a bad dust day. And that is related to climate change. So we have to help people join up the dots. To go back to the point that I made at the beginning, we have to get people to realize these connections, that things are connected. Last point really on the strategy, and Sir George talked about this. I mentioned cold shower when I saw that communique. Somebody, somehow we failed. The lead Prime Minister for Health, didn't he champion this at heads to say, we must make sure this is talked about? What about the CARICOM Health Desk? What did they do? Helen Royer, who's a good friend and colleague, said, oh, we're doing well in CARICOM. But how we could say we're doing well and the heads communique didn't mention this once? And the CISOs, HCC, Earth Medic, others, we need to make more noise. We need to get CARFA back in the game. Neither CARFA nor PAHO are mentioned in that communique, not once.
Absolutely.
Needs to stand up more for NCDs as a major health and economic priority and get with the heads to get that on the agenda, working with Prime Minister Drew and others.
Thanks. Over to you. I really like the analogy, by the way, but I hope when we're hitching onto this train, it's not heading towards a cliff, but moving away from it. And Joy, I'm passing it over to you. Go right ahead.
We're at the end.
So I want a multi-sectoral perspective. And I also want some element, I'm not sure where it would be, that coordinates, because a lot is going on, but not many things or people are coordinating and bringing this all together. Multi-sectoral is important. We are public health practitioners. We don't even talk to our other colleagues in medicine about this, or our colleagues in dentistry. There are so many interventions for primary prevention and for secondary prevention to stop the very expensive complications that we can do, and we need to start doing that. And then when it comes to the coordination, one of the important things about the coordination is the elephant in the room I spoke about. The funding, the specific funding for NCD programming where there are gaps is missing. So I see this as an opportunity, one, for the next iteration of Caribbean cooperation in health, so that we ensure that all of the countries are working towards making sure that the gaps are filled, working towards making sure that all sectors are on deck. And that funding, if we could write a project, that funding would also say that certain things have to be in place. I'm the vice chair of the technical advisory panel. We have CSO on the board of the pandemic fund. We have to have young people up front and center and speaking and doing and showing us the way. We have to have a greater emphasis on prevention. The Caribbean has become the treatment center for NCDs, not the center for prevention initiatives. So those are my priorities. I hope I stuck to time this time.
You actually have a few seconds, but thanks very much for that. And I appreciate your priority listing. And I just wonder, as I listen, we keep mentioning that someone has dropped the ball, but on a larger scale, the communities that we represent don't even recognize or didn't even know there was a ball to be dropped. And that's our responsibility. We haven't gotten that message out there. So as much as the ball was dropped and we can all see it slowly dropping, we have an opportunity to educate our Caribbean citizens and electorates who are all alive but not dead, right? We can have the opportunity to educate them so that they can see the ball and push our leadership so that it isn't dropped, or at least it can be reclaimed. So George, over to you, priorities.
Yes, a couple of priorities that I would say. One is immediate. I would ask as a priority that CARICOM, which is organizing this heads meeting in September, that they suggest to the heads that it not be a show and tell meeting, but it should focus on the possible solutions to the problem. And CARICOM can do that. Otherwise, the Prime Minister will get up there and say, oh, everything is happy in my country because we've done so and so. So that is one of my priorities. The second is, and James mentioned climate change. I happen to be one of the co-authors of a paper that looked at the prospects for the future and mentioned that there are three existential threats which are co-linked. One was climate change. Two was a coming pandemic, the inevitability of a coming pandemic. And three was NCDs. Now, that's fine. But as all of us co-authors agreed, you know the old adage, if a tree falls in the forest, does it make a sound? We can trumpet as much as we like, but unless your colleague with whom you had dinner knows about NCDs, you don't get the political action that you need. So once again, I revert to the idea of what is a trumpet? It's the media is a trumpet. And we have not been as good as popularizing what NC, I use that word deliberately, popularizing NCDs and the relationship and the possible solutions as we have been. Much of what we do has been inward looking. I wouldn't say navel gazing because that's bad, but inward looking and not seeking to popularize the possibilities that exist and popularize the solutions that might be taken. So once again, I revert to the idea of let us be much more aggressive about the involvement of the media. And as Joyce pointed about intersectoral correlation, you know my view about this. The Ministry of Agriculture couldn't care less about what happens in health. He doesn't get any votes for this. So the only way to do it is to have it at the highest, above the pay grade of each individual minister. You know where that is.
I think we all do, yes. And I mean, on that point, what do you see as how do we overcome political inertia and policy inertia?
How do we do it? We do it by constant drumbeat from two areas. As Daniel said, from those people who are involved, and also, how should I put it? Unfortunately, most of our countries, there is still attention to the voice of what may be put in inverted commas the elite. People like yourself, Kenneth, yourself, James, their voices will be heard in the Caribbean. And it is, I think, necessary to give more structured approach to involving the media in getting the voters so engaged that the politicians take note.
You use an interesting word there. You didn't say the people in the Caribbean or people living with NCDs or even the Caribbean community. You said the voters, which to me triggers another reaction that in order to get political buy-in and political will, we really need to make health political again, such that we see it when going to the polls, health is on our agenda. That when a politician comes and says, do you want the roads repaired? Yes, but I'm worried about the NCDs and what are you doing about it? And what measures, why when I go to the supermarket, I can't tell what's in anything that I'm eating because I don't understand the labels. What are you doing with the money that you're taking in this sugar sweetened beverage tax? So, how is this helping me and in health? So in other words, how do we translate to voters the conversations that they should be having with the electorate, with their elected officials?
Kenneth, one thing that I urge all my colleagues not to use the phrase lack of political will. I could say there's always political will to do the right thing if it is to their advantage. Absolutely. So there's no lack of political wallet, perhaps, but there's no lack of political will. It's to how to mobilize the political will in one or other direction. There's no lack of political will. So I don't think we hide behind that shibboleth, lack of political will, but it's not so. It's not true, and I urge people not to use it, not to hide behind that, as I said, that shibboleth. Not to hide behind it. This is how to mobilize political action, not to fall back because nothing happened or there's lack of political will.
Sure. Thanks very much. And passing on to Joy, what do you see are some of the main policies? You're muted.
Some of the main policies that are going to be the solution policies?
Yes.
Well, I've seen policies put in place that somehow die a death because they're not really enforced, and you ensure that they're fully implemented. We have quite a few countries that have no smoking in public places, but that policy at the regional level, so there would be no smoking at the regional level, has been only talked about, and I need to see that implemented. I need to see more of a focus on the healthy and nutritious foods being affordable. People still scream about that. Yes, they have taken off value-added tax. Yes, there may be some subsidies to the farmers, but it still isn't shown up when you go to shop at the supermarket. I need to see policies about increasing exercise and exercise that is appropriate to the child in schools. We still haven't done that. And that's one of the ways that we are suffering. I need to see the policy implemented on the regional level about the labeling of food, not just manufactured, but also imported, because we have a lot of food imports. I need to see the policy about improving prevention measures. I need to see the policy about all of the ministries, start with government first, all of the ministries being on some sort of national committee, which ensures that you have to put something in your budget. Let's draw from HIV policies. Something in your budget which works to stop the tide of NCDs. I want to see those policies.
Thanks very much. And it's interesting you closed with using HIV as an example. But the reason why there was this whole all of government approach to HIV, at least in Barbados, is because it was held above the level of pay grade of minister, right? So over to you, James. You're muted.
Yeah.
James, I know you're never silent, so you must be muted. There you go.
Policies? Is that the question, Ken?
Yes, that is the question. What are the policies that you think should be prioritized?
Well, I was pretty explicit about them earlier. I think you need to hitch the NCD policy movement to climate change, for many reasons, and insert some of the funding that is needed into the national NDCs, because there's a big funding opportunity there that we're not tackling. We need to take this issue to the annual Caribbean Health Financing meeting and show the Social Security directors that by paying attention to NCDs is going to make them a more sustainable operation. So there's a combination of a policy and a strategy answer about what we need to do going forward.
But how do we get past this inertia then, but to implement policy?
I think Sir George touched on it earlier, so did Danielle. We need to make more noise in different ways, from patients, from people, from thought leaders. I put in the chat earlier, Ken, it sounds silly, but simple messages repeated often by credible people is when policymakers pay attention. So if HCC can help orchestrate that, simple messages repeated often by credible messengers, it's gonna have traction. In addition to your behind the scenes work with the Secretariat, with the lead Prime Minister for Health, then the policy will come back into sharper focus. It's yeah.
Thanks. And Asante, over to you.
Kenneth, I sit here and we speak of policies and you're asking what will help us get past this inertia. You mentioned the media and you said, media personalities suffer from NCDs. I wonder if the politicians don't suffer from NCDs, so we wonder what do they do about their NCD prevention? And we know what they do, right? So this is the inertia has to come from the grassroots. We have to also remember, we're saying the youth are our new leaders of tomorrow. This means, one, education from nursery. teaching them what they need to do to be healthier, bringing back family life is very important in terms of, and that is very, very important in terms of how to eat, how to move, how to deal with your stress. How do we be productive citizens from nursery? Other thing, Kenneth, all of us are getting younger. Danielle is the youngest, I guess, and then me. Do we successfully pass that baton? Do we successfully give the tools needed for not only moving with that policy, but also taking it a level higher? I'll never forget, I told my grandmother, who's a feminist, Viola Burnham, and I said, you made us as women being educated, but we still have to cook at home. And she was very clear. We brought y'all to the point where you can be educated and be in the workplace. Now we have passed the baton on to you to go further. This is what we have to do. Be successful baton passers in that relay, because we have to empower the youth, not to only say, yes, you can lead us, and yes, we listen to you, but give them the tools so they know historically where we come from.
You lost her.
And it was such an impactful comment that I wonder if she paused there for effect. So Danielle, I'm going to pass the baton over to you. Maybe Asante might regain connectivity, but I'm passing the baton over to you. Go right ahead.
Thanks, Dr. Connell, and just obviously echoing everything that Asante had. Oh, she's back.
I'm
Asante?
back. Sorry, that's what you see. I got stuck because everybody's upset. But we need to successfully pass that baton to the youth. And our policies, yes, the youth have to be involved, but we have to work at different levels, just as Joy said, multi-sectorial, all the levels. We can't only depend on the powers that be. We have to work at all levels, because we have to also show them, other than political will, there is social will. We want to survive and we want to be healthier. And so everybody has to work, and we have to work together. There's no doubt about it for us to achieve 2030.
And there's social power, not just will, but power.
Exact power, exactly.
Danielle, go right ahead.
Thanks, Dr. Connell and Asante. You know, I fully agree with everything that you just said. And I would just say, noting Kayla's comment from earlier that youth are not future leaders, they're leaders of today. So I just urge our allies to really emphasize more urgency maybe in passing on that information, because what you said is critical. And I don't think we should wait to pass on that information to our youth leaders. What I'll say, Dr. Connell, and it really is just, again, kind of echoing what's been said already, is more strategic. So going back to the conflict of interest piece, and really, again, encouraging our leaders to see conflict of interest policies to mitigate and manage conflict of interest as a tool to advance political action. I think there has to be an acknowledgement that that tool exists, and it really is meant to protect political and policy-making spaces. And even to the point that Dr. St. John made about multi-sectoral action, I think the conflict of interest policies in particular are critical at that point. So again, it's one of those things that will really help us advance. And second point is to strengthen civil society and youth. We've heard it echoed from everyone's comments so far, but as Sir George mentioned, the constant drumbeat. How do we ensure that the drum is being beaten? And again, I think that goes back to the institutionalization of these voices. But I also think that there's also an element of capacity building that needs to happen there, so that our civil society and young people feel empowered to be the voices that we've all been speaking about. And even in the engagement with the media. So we know that the media can tell stories, they have facts, but they still need to be able to, and we've heard the power of it, draw on people's experiences. And I think, again, being able to connect the media with civil society organizations and the voices of persons with lived experience will be very important. So on that point of Dr. Connell, so again, re-emphasizing the conflict of interest policies as a tool. And again, really thinking through how we can ensure that voices, the critical voices, are empowered.
Thanks so much. Thank you. Thank you. And I mean, this has been such a powerful panel that, I mean, so let me congratulate all of you for your very robust conversations and your candid comments and suggestions. And I'm also going to remind the audience to post your priorities in the chat, and more importantly, post your questions in the Q&A section so I can pose some of them to the audience. There is one question that has gotten my attention, but there's also a comment. And let me just scroll up and see if I can find it. I want to signal this comment out, not only because this is a colleague, so she can curse me after if I use the wrong intention. But okay, this is from Dawn Scantlebury, who is an interventional cardiologist in Barbados. And she says, I agree about de-emphasizing mortality. We need to talk about disease. This is from an interventional cardiologist. Young people in hospital beds, emergency room waiting times. As she says, money, money, money. Or maybe lack of money, lack of money, lack of money. We need clinicians to stop bearing responsibility for the failures of the health system and redirect complaints to these leaders who have abandoned us to the wolves. Now I see Asante, I knew you were gonna shake your head at that one. Do you have a comment because as a clinician, what I am observing, quite frankly, and I'm going to be very blunt on this, is this almost disconnect between the NCD problem at the grassroots community social determinant level to the practitioners on the front lines dealing with the outcomes of NCDs. And I don't know why this disconnect is there. So what do you see? How do you connect these two worlds that really should be seamless?
But that's the problem. And the issue, and I don't know if you see it in Barbados, but I personally find that I've looked at it time and time again in Trinidad, and I'm not a Trini, by the way, I'm Guyanese, but the pandemic, post-pandemic, affected us tremendously in terms of that communication. Because you have the hospital doctors, you have some of them that went through fight or flight for 2 years, and that's how they learned and graduated. So we weren't fair to them, because they didn't learn what it was to be a GP with NCDs. They were in fight or flight for 2 years. And then we have the private doctors who were in fight or flight, but then dealing with the NCDs. And we have the government who seem to have been in fight or flight and still in fight or flight. So we need to now get back to the table and have frank discussions. It's not fair for the population to be going to public sectors and being told, we really don't have the drugs, or we just filling out a prescription, when I could say, how are you eating? How is your work day? How is your life? You understand? Because if we're not looking at that holistically from a public and private sector, we're not getting anywhere. The person, the patient, the ones we want to have less mortality and less morbidity for, we have to understand them as a whole in order to help them. We can't just take one thing or the other, and our job in public sector can't be to write a prescription. I cannot have a heart patient and tell you wait 2 years for an echo. I can't do that. That's not making sense. So we have to make sense out of the nonsense, and we have to really break that inertia, Kenneth. We have to come out of the fight or flight. We can't blame the COVID-19 pandemic anymore. We need to regroup. We have to regroup, Kenneth. That's what we have to do. And UE has to take the lead. UE has to see what they're doing. Train the physicians properly. I'm very sorry. But UE is the major one. And make them understand our nurses, they're key. But if your nurse is not motivated and don't want to educate them, what are we going to do? Because they're key educators as well. So we have to really strengthen the primary healthcare model that Paho is speaking about. And that means in the community. You understand? So it's not just all going to tertiary or to secondary. So that's what I think we need to do, Kenneth. I don't know if that explains it.
Thanks, Hassan. And I'm so glad that you called out my institution for the record and not me. But I'm not going to say, maybe I will say that I publicly support you. So thank you for those comments. I see a question that was posed to you and you've answered in the Q&A, but I also want to pose it to the rest of the panel. How can our communities be mobilized? And Joy, I'm going to ask you to respond here. How can our communities be mobilized to support NCD sufferers or people living with NCDs in the community by neighbors, social groups, churches, other service groups? So what I like to call the non-traditional players, the religious groups, the indigenous groups within the Caribbean, the indigenous practitioners, those groups, how can we mobilize them?
We not only need to mobilize them, but we need to make sure they're all singing from the same hymn sheet. So James talked about the same message being repeated, that same message being repeated to the people who are living with NCDs and the people who are supporting them, their children, so that they understand, well, if you keep eating that jam puff instead of taking your fruit and vegetables, you will have these problems. You need to have a message tailored to each of those groups that's trying to change the tide. And when everybody is singing from the hymn sheet, then the politicians will realize, but my voters are telling me that I have to go a particular way. And they're not taking no for an answer. In terms of mobilizing them, yes, the press has a role, the awareness aspect of it. But the public health practitioners, those are the persons, Asante, who are going to go and make sense out of nonsense of a person who still needs hospital care, being discharged into a home alone because the hospital is too full. They're the ones who are going to mobilize all of the other government agencies in the community to make sure that there is going to be proper management of that person. And the politicians need to understand that their role is making money, yes. They may be tired of health because they figure they spent too much money on health during COVID, but they have to understand that their role now is to promote wellness, getting away from disease now. So those are the things that I think will work to mobilize, but we need all hands on deck. We need someone pulling those hands together. And I like the idea of going to the heads for this the side event. That side event needs to be very carefully tailored, so it is not a talk shop. And then that side event needs to be the run-up to the new heads of government meeting summit on NCDs, where we prescribe, using that word very carefully, where we prescribed the 21st century Caribbean approach to this tsunami of NCDs.
Thanks very much. I want to just close the questions from a comment that was made earlier, and I know that Sir George mentioned it as well, so I'm going to direct it towards him. I mean, we mentioned the fact that we should see the media's role as not just a reportive role. What are some of the tangible, and maybe there's historical evidence of this, that the media has played a substantial role in moving the barometer for NCDs? Like, did it play a role in the Port of Spain Declaration, for instance? I mean, so moving forward, how can we engage the media more or in different spheres? I have to admit, I have been part of at least 2 media workshops, so workshops specifically designed for the media. At these workshops, a barrage of NCD data is presented, and the media listens, and then exactly what happens after is what we're trying to prevent. They report on the event, and that's absolutely it. So how can we really meaningfully engage the media?
There were 2 parts to your question. How was the media involved in the Port of Spain Declaration and the event? In truth, the media was very little involved in the lead up to it. But during the conference, there was tremendous media coverage. And your colleague, Julian Rogers, was very instrumental in getting tremendous TV coverage. I think James remember that. So there's coverage. So how you get the media involved in anything, I mean, this is a discipline almost in its own right, but it has to be attractive to their readership. And one of the things, the problems we have with NCDs, they are presented as almost sterile problems with death as the end. For example, how many stories have you seen from young people in the Barbados Advocate about the problems of NCDs? How many times has the editor of the Barbados Advocate been interviewed about NCDs? How many times has he spoken at one of your conferences about what his paper can do to promote NCDs? There is a board of the Barbados Advocate. I think that there's a board, apart from the editors, a board. How many times have you spoken to the chairman of that board about what his newspaper is doing and the possibility of there being pluses for his newspaper to be involved in this area? I think these are things that could be done. I'm not saying that tomorrow we're going to convert the media into focusing on nothing else but NCDs. The picture of childhood obesity, I ask you, how many people what Barbados converted to from the bad days to the days of Frank Ramsey when malnutrition was no longer a problem? How many people know about how it is converted now to a situation where children are getting fatter and fatter? These are all stories to be told, and it is part of our responsibility to tell these stories.
Thank you very much for that. Thank you very much. And I was just reminded by Sheena Edwards that ACC is working with the media chairmen and boards and editors in kind of enhancing this engagement as well. But thank you for those comments. So we've come to the end of a very vibrant and candid, I might add, panel discussion. Thank you all panelists for your remarks and also your responses to questions. And I'm now going to close this panel discussion. I see people are sending applause as well, so you can clap virtually for them. I'm now going to close the panel discussion and move on to the next section of the agenda. People behind NCDs, the civil society voice, and ask Mrs. Francine Charles, the program manager, Childhood Obesity Prevention Program of the Heart and Stroke Foundation of Barbados, to deliver her through, and an esteemed member of the media generation as well, media fraternity. I almost said the Julian Rogers generation, but Francine would kill me. Go ahead, Francine.
Thank you so much, Kenneth. And just good afternoon, good evening in some places, and maybe even good morning to everyone. It is truly my privilege to issue the call to action today on behalf of my amazing colleagues in this webinar. The panel discussion was excellent. As I listen today, and I feel as if some of you had the very same thoughts, especially those from civil society, the same questions came to mind. How high must the statistics reach? How heavy must the financial burden become? How many more sad individual stories must be told? And how many more lives, Sir George, must be plagued by NCDs? And how young do these people have to be for our region to arise and to take strong, brave, and consistent action in the battle against NCDs? My call to action is simple. To our policymakers, we understand the current global crisis and the battle for developing countries to be treated as equals in the midst of international challenges. We are understanding it. We understand the need for you to react immediately to those issues, and we understand the need for you to be proactive with solutions for the arriving financial, social, and natural storms that are rising. But we urge you in the midst of civil society, at this juncture of our history, to also be strategic and to be very wise, to realize that your efforts and your work are all for the people of this region. And the health of your people is the fundamental platform for any future success, even in the midst of AI. So be strategic and be very deliberate, and head off to the 4th UN high-level meeting in September with a collective determination to secure your region's people by giving us, or at least our children, a chance at a healthy and productive future. And to our civil society and those here involved in this process and in this journey, I say keep waving those red flags, keep knocking on the doors of our policymakers, keep pinpointing the conflict of interest that plagues our governance practices. And yes, keep honking those horns or beating those drums until the voters get it. Be strategic, and guys, do not get tired. Be inspired to push even more. For every little win will strengthen the baton before we pass it over. And to our youth, I say, don't you give up. In fact, I say to you, arise. Thank you very much, Kenneth.
Francine, thanks so much for that. And thanks also for reminding us to wave those red flags, or should I more appropriately say, raise those black octagonal warning labels. There you go. Over to you, Sir George, for the closing reflections on what has been a tremendous buffet of NCD, hopefully challenges, but also solutions.
Thank you very much, Kenneth. And after Francine, I don't know what more I could say. Hers was a very fitting coda to this webinar. But first, let me thank Marisa Maisha for organizing it, and Maisha and her team. Let me thank you, Kenneth, for the masterful way in which you have conducted the proceedings. If from time I sounded a bit bitchy and complaining too much, it is not that I have been totally dissatisfied with some of the things that have been done, but as Oliver Twist, you remember he said, Mr. Dotheboy, I want more, or as better as Griner put it in his clip. So we want more, Griner, we want more. We just wish more to be done. And two final comments I would make, in addition to thanking all the participants for the amount of work that they put in and the obvious amount of thought that they gave to the whole issue. And I hope that there'll be follow-up to this webinar. And I really do hope that there'll be action on the suggestion that there'll be a final cri de coeur from this webinar to New York, asking that some of the parts of the political declaration, which we hold very dear, will be reinserted, especially language on civil society, and especially the language on the fiscal aspect of it. I think we in the Caribbean should be justifiably proud of the role that the Caribbean played in getting this thing moved to the stage. But as a follow-up, as a complement to that pride, I can no more than echo the call that Francine gave just now at the end and say amen to all that she said. And I wish us all well, and I wish us all to continue. I don't like the military analogy of battle, but to continue to contend for what we know is really important in the disease realm. And don't let us be divided among those who care for the public's health and those who care for the individual. Because after all, as more than one of you has said, I think I heard James say, all these things are interconnected, and we have to have the genius of showing the interconnection and have the genius of showing to our policymakers what they can do on an incremental basis to correct some deficiencies that we have identified. So thank you all very much indeed, and I thought it was a very, very useful seminar, well run, well organized, excellent presentations, and I'm glad to see the level participant involvement and appreciation. Thanks again. Good
Thank you
afternoon.
very much, Sir George. Thank you for those closing comments. And let me just record for the minutes as well that none of us thought that you were bitchy at all. We were inspired by it. So hopefully it was contagious, because in our efforts, we need to be a bit more candid and direct. And so your very candid comments and calling for direct action and direct communication with CARICOM, because certainly, as we've discussed, a ball has been dropped. But more importantly, there are many people out there not listening to this call, not even aware that there is a ball that has been dropped. So I'm going to close this webinar. It has been a pleasure being moderator of the Caribbean Regional Stakeholder Meeting in support of the 4th UN High-Level Meeting on NCDs and mental health in New York on September 25th. Please don't finish the conversation here. Send us your comments. Look at our web pages on both the NCD Alliance and the Healthy Caribbean Coalition. Follow us on social media, especially Instagram, so you can check out HCC Youth. They're doing remarkable jobs there, as well as on our other spaces on LinkedIn, Facebook, and we're also on Twitter, now called X. Also, reach out directly to the HCC. Send us your email addresses in the chat so that we can sign you up to our newsletter, and follow this conversation. Let's keep the momentum going. As many voices that you've heard on this webinar this morning, the most important voices are yours. Thank you very much for joining us, and it's been a pleasure hosting. Thank you.